prevalence of child marriage in the world. And Eastern and Southern Africa is home to over 50 million child brides, with the largest share of child brides being in Ethiopia. 2 out of 10 countries have the largest numbers of child marriage in the world. They are found in our region. Child marriage also occurs among boys. However, in just a sample of 3 countries within the region, the level is at 1 in every 10 boys was 10 men that were interviewed were married as children. So the risk of child marriage, as mentioned, varies, but it is highest among the poorest households, among those with little or no education, and in rural areas, which doesn't mean that it doesn't happen among people of more affluent or maybe in urban areas. It happens, but comparing with these categories, it is higher among the poorest, less educated, and in rural areas. Okay. Yeah, and then to also mention a few, child marriage is also linked to child marriage. Most marry young, give birth within 1 year of getting married, or at least within 2 years of getting married. So it is to take them. Yes, do we have another mic? Okay.
On addressing the economic drive of child marriage, let's say specifically poverty, what are you doing about it?
Okay, so my name is Lungo Witola. I'm from Western Province, Zambia. So in relation with child marriage and early pregnancies, let's take for instance where I am from, there are a lot of cultural or communities that lead these children to have these relations that leads them to early marriages or early pregnancies. Like a lot of things that are being taught in those traditional, let's say, initiation ceremonies that are taking place that side, because both girls and boys are initiated at a certain point in their life. During those ceremonies or during those activities, they are taught a lot of things that are not supposed to be taught to children at their age. So I just want to know if our leaders have taken accountability of the matter and will please talk to the traditional leaders so that they can see through about this issue. Yeah.
Just 2 more questions.
Good morning. My name is Amanda Sauter from Malawi. So in line with the theme of Indaba, it's from political will to political action. I just wanted to ask, you mentioned on opportunities for child marriage, that there is the Global Development Agenda or program, and that there are 12 countries, but only 4 in Southern Africa. Now, as a youth, I found this interesting, the program in relation to ending early child marriage. How do I take this back to my government, to partners in Malawi, and say, look, like, can we get involved in this program that's been run by UNICEF. Maybe I attended this program, I've seen this program, it can help us on the ground in the community. How do I now engage my government and engage people to come into this agreement? What would you advise? Thank you.
And the last one.
Good morning. I'm Tracy Ruzengwe from Zimbabwe. So I wanted to ask on the part of keeping girls in school, if you involve the component of menstrual hygiene, because some girls end up missing school because they don't have proper sanitary wear. Thank you.
Okay, thank you so much for your questions. Very interesting. So in terms of the question on how we are addressing economic challenges, so this might vary from country to country, but to give you an example of what is happening in Zambia, we have a lot of different programs currently. For example, if you've heard of the social cash transfer, so the aim of such programs is to assist the most vulnerable households to get out of that situation of desperation, to bring them up to a certain level where they are not, to get them out of a point of desperation where they don't need to get their children to get married for the sake of gaining an income, or maybe just to reduce the burden of care at home. So there are programs like the social cash transfer,
and keep on being engaged in child marriages. So what exactly can be done so that we can maybe close those key gaps? Thank you very much.
Um,
We'll have the second question here.
Thank you very much. My name is Gavinda Galimina. I'm from Zambia. Mine is, I think, quite interesting. I want to ask what UNICEF is doing. UNICEF is at the top of in sorting out issues of child marriages. I want to ask specifically what you're doing to educate the boy child on the effects of early child marriage towards the ladies. I think we've talked about how it is affecting the ladies, but we've not really hammered what the men should do. So exactly what are you doing? Because I know growing up in the village and as a case study myself, you look at your father is married to 3 wives, you get inspired to want to marry 3 wives. But then what are you doing to break that chain so that by the time I reach at a position where I need to marry 3 wives, I'm already educated and I know the effect that has on the girl child? Thank you very much.
Okay, thank you so much. So in terms of the question from our colleague, our friend from Zimbabwe, girls being supported, they keep on dropping out, they go back to school, they drop out, they get pregnant again, they remarry. So those issues are very much everywhere. You know, we see where you support somebody, they are back in school, they withdraw. And the issue there is that, you know, if you look at those interventions where those things are happening, you will find that the approach is not holistic. If you use only one approach of education, it is likely to happen that people will keep on dropping out and coming back and dropping out because you are not addressing other things. Maybe the biggest issue for those particular girls who are dropping out all the time is not really staying in education. The problem might be at home. So child marriage is one of those issues which you need to have a comprehensive approach. And this is exactly what we are doing. So looking at the traditional aspect, what are the harmful practices? What's going on in the homes? What's happening? What are people believing? What are people doing? Then looking at the education, is the environment at school? We have re-entry policy, but what is happening when the girls go back to school? Is there stigma? Are there issues that are causing the girls to leave school? So we need to address it holistically. You know, support mechanisms. I might go back to school. I have a 3-month-old or 6-month-old baby, and I have no one to look after my child. Eventually, I'll just say, let me just stay home and look after my baby. So it's a complex issue. So you can't just solve one problem. You need to look at what are the other factors happening in those young people's lives. And when you do that, the chances of a permanent solution are high. Then on the question of how are we engaging boys and men? So I'm glad to say that the global program on ending child marriage is very comprehensive. And one of the key components is on engaging boys and men. So boys have not been left behind. There are some specific the programs. For example, there's an exciting program called Coaching Boys into Men. So basically what this program does is to identify male role models, okay? Male role models who and engage, you know, on, they engage frequently and they discuss different issues related to gender equality, harmful cultural practices, issues of child marriage, and the role that they can play as boys and men in supporting girls or in addressing these issues. So definitely men and boys have not been left behind. The participation at the moment could be small, but it's something that is being scaled up. Thank you so much.
All right, Madam, before you leave the stage, there's a burning question from our friends here. And I want to make sure that we are inclusive in our questions and answers. So please, you have the mic. Will you? Yeah. Like you just-
Thank you so much. The presentation, the question is going direct. You are talking about the ending early child marriage. Now, do you have any statistics when it's coming to people with disability, which we find when we want to know the statistics?
Okay. In terms of specifically like a report that I refer to at the moment, it may not really be there because the countering is just policy, but this is a gap which has been noted. And this year, we started implementing phase 3 of the global program. And one of the key things that we are bringing out is capturing, are there adolescents with disabilities that are being affected by them? And so the information is being collected as we implement, and adjustments are being made as we implement. So as we encounter the problems, as we encounter the scale, we are also changing that. So every year, the programs are reviewed, and where there's need to redesign, we redesign. So like this year, there's a big focus in UNICEF, for example, UNICEF Zambia specifically. We have now even like a specific unit, which is called a disability unit. It's falling under the social policy unit. And this one is specifically ensuring that we are leaving no one behind. So whenever you design a program, they come in and they look at how are we targeting young people with disability? What are we doing to make sure that their issues are also addressed? So definitely it is something on our agenda and something that we are looking to. So yeah, and also because the statistics that we pick to look at the rates of child marriage depend on bigger national statistics like the Zambia Demographic and Health Survey, which take a bit of time to come out. So this year, there's a process to have more data, and we are waiting to see how they are going to give us information on young people with disabilities. I hope.
Thank you so much, UNICEF. I can still see hands. The people raising hands, were you part of the fireside chat last night? Were you part of the fireside chat? So UNICEF, I know that the fireside chat was Zambian only. It seems the Zimbabwean colleagues have so many questions. You can find time to network with them or make a plan for them as well, because they still have questions for you. Is that okay? Okay, thank you so much. We have to move because of time. And how were the side sessions, by the way, yesterday? Did you enjoy them? So what we are going to do is we are going to go into a presentation with the Ministry of Health here in Zambia. And the presentation is about teenage pregnancies. And then after that, we are going to have a recap. Now, this recap is going to be country-led. Please follow instructions here. Country-led. And what we are going to do is, as a country, you come in front here, you choose 3 representatives who will give us your key highlights from yesterday. But before you do that, you give us a dance. Are we together? Should I repeat the instructions again? The Zimbabweans are smiling. So, after the presentation, you come to the front, 3 representatives, you give us your key highlights, and then you give us a dance. Are we together? Minister of Health, we're ready? Okay, thank you.
I thought there would have been a dance before Oh, it's, okay, no, it's fine. Good morning, everyone. How are we doing? What did we dream about? You only dreamt about food? Serious? Okay, so I'll take you through the presentation from the Ministry of Health. I'm Mabel Mwemba. I'm Sheke, coordinating the Adolescent Health Program. So to focus on teenage pregnancy, but then there was another session that should have taken place yesterday on SRH. So the two teenage pregnancy is a subset of SRH. So just the mere background is, I hope we all know who an adolescent is as we are here. This is any person aged between the age of 10 and 19, just in case we had missed the age ranges for an adolescent, and a young person 10 to 24, a youth by the UN 15 to 24, by the Zambian definition, a youth is 15 to 35. Is it? Yes. So, this stage is the one stage that we all underwent, even as the adults. A lot of changes take place at this stage. And so as when these things are happening to a young person, they tend to be confused and not understand, as long as they were not or taken through what is expected as they are transitioning from being a child to an adult. So during this stage, a lot of psychological issues, emotional issues tend to come along, the body changes, physical changes that we get to see. We know all those things that take place in girls, similar, while others are different. Apparently, in the health perspective, this stage is supposed to be the most healthy stage of someone's life. You are most healthy. So looking at rest of their lives. We've seen very worst the only remedy or treatment is to remove the uterus, to remove the womb. And this is a 14-year-old, 15-year-old. What happens the rest of their lives? So there are very serious consequences to teenage pregnancies that we've seen among young people. Just recently, last month in Muchinga province, I heard of this very sad story because one of our surgeons is a trainer in adolescent health. And so this 15-year-old girl performed unsafe abortion in the community with the help of the mother and some elderly person. And they were hiding. So by the time she was brought to the hospital, it was a bit too late. She had caught other infections that had spread in the body. They tried to save her womb, but they just had to remove it to save her. So imagine what will happen to this girl when she wants to get married and settle and have a family. That's just a 15-year-old. So there are these sad consequences that maternal complications that are attached to teenage pregnancies. So just looking at the picture in the country, which regions or areas of our country are most hit? So the darker the color, the higher the rate. So we have the highest being Southern Province at 43% of teenage pregnancy, and the lowest being Lusaka, they're about around 15, 16, with Copperbelt, Northern Province. But the highest Southern, Western, Eastern Province, and Northwestern Province usually tops in terms of teenage pregnancies in this country. So we also try to monitor because the previous slide, that is a demographic health survey, and the last data was 2018. But we are also trying to monitor through our health information system that shows us how many of the adolescents come to our health facilities seeking for antenatal services. This is our proxy indicator in us trying to track how much we are performing. And so 2021, we're around 23.7%, rose up a bit in 2022, and last year we were at 23.7%. So we hope that the next ZDHS, which was conducted across to this year, in the same ranges or probably below 25%. We hope for once we can drop from the consistently high 29% of teenage pregnancy rates in this country. So we want to relate this in our system in terms of how many of these adolescents are accessing contraceptives. If a pregnancy is to be prevented, there are only two ways. It's either one is abstaining from sexual activities or they are using prevention. And that prevention is contraceptives, famously known as family planning. So it's either of the two. We know how many of our adolescents are sexually active, so we look at the population that is sexually active. How many of them are using contraceptives? So the figures are not so good. If you have your pregnancy rate at 24% and your contraceptive use at 16%, what is happening with the difference? Meaning the pregnancies will continue, isn't it? What we've noted with our adolescents is they are good at preventing the subsequent pregnancies and not the first. In most cases, the first pregnancy will happen unprepared, unintended, just like the sexual activity would have been unplanned itself and unintended. So it just happens sporadic. But when they give birth with that first child, they will try and be careful to prevent the next pregnancy, as long as they are not in a marital relationship. But so we need this to go up. We need contraceptive use to go up for us to reduce that teenage pregnancy. for the sexually active adolescents. Another part of SRH, once you have unprotected sex, you expect two things or two results to happen. It's either it's a pregnancy for a girl and an STI. For a boy, male, it's just an STI, isn't it? Or HIV. So STIs is part of sexual reproductive health. HIV is part of sexual reproductive health, but we exhausted the HIV discussion yesterday. I think it was ably handled. And so just for STIs as well, the adolescents and young people, 20 to 24, of all the cases that we recorded in our health facilities in 2021, 22, 23, adolescents and young people are almost accounting, almost half, 45%, you're close to 50%, isn't it? Across all age groups. So you people who are in here are accounting for half. You people in here, isn't it? Yes, we are accounting for half of the STI cases. What does that tell us? A lot of unprotected sex is happening. That is the only way you get a sexually transmitted infection. It means you did not use a condom in that sexual activity. You are not aware of your partner's STI status, HIV status. And so we are accounting for almost half of the cases that we are recording in our health facilities for STIs, just this small age group of 10 to 24. So what are we doing as a Ministry of Health in trying to reduce these ill health issues that are affecting adolescents and young people? There are three broad headline strategic interventions that we are doing. The first one is we want to ensure that the services are available in our health facilities. If the services are available, at the end of the day, we hope that adolescents can access the services that they need, contraceptives in terms of preventing HIV. And now for other diseases that manifest later in life, we talk about cervical cancer. We are doing prevention in the adolescent group through the vaccination of the human papilloma, against the human papilloma virus. So all these interventions, menstrual hygiene management issues, issues about puberty, STIs, mental health, and all these things, if services are not available, young people will not be able to access them. And so increasing availability and utilization of the adolescent youth-friendly spaces is one strategic intervention that we are doing. And the second one is we want to ensure that the health workers have the capacity. It's one thing to have the service available, but the other side of having the right person to offer that service, to deliver that service. Are they friendly enough? Are they accommodative enough? Are they responsive enough to the different health needs of the young people? And so capacity building, which is an ongoing thing to ensure that our service providers, as well as peer educators who are yourselves, we work with peer educators. We want to ensure that we scale up the peer-to-peer service provision as well. And the last intervention is strengthening collaboration and linkages, of which this Indaba is part of that which we are doing. We cannot do it alone as the health sector. We need different stakeholders. We need the communities to work together for us to foster this. Health issues are beyond the health sector alone. Diseases are acquired out there in the community. In fact, we are in the receiving end. We are expected to fix things that have started from somewhere. And we are in this space where we are told, fix this, treat this person. But if we work together as communities, we prevent from the communities where these things are happening, then we will reduce the burden. And at the end of the day, we will help ourselves even have an effective health system. So this is where I end. Moderators, I know we're supposed to have a panel after this, so I'm not sure that panel is ready, or we'll do Q&A.
we could have a bit of a Q&A, maybe just, and the hands become so many the minute we say Q&A. So let's take it differently. Let's take one question from this side, another question from this row, one particularly from, yes, thank you, and I can already see a hand with our friends here, and then another question there, and one from this table here. That makes it very many people talking. So let's make our questions short and succinct. So please, if you spoke earlier on, let's give your colleagues the opportunity to speak. Thank you, helper. Okay, I see we have a hand there. We have a hand here. And on this row, we have a hand there. All right, thanks. Then we'll go to the other side. Please go ahead.
My name is Mvola Beauty from Zambia. So my question is more like a concern concerning the SRHR. So one of the key components of SRHR is having access to abortion care and services like legal. So I feel like, for example, it's a situation, I'm 21 years, then I get pregnant this year, maybe this month. Again, I come to the facility, you give me access to do the same abortion. Then again, next month, I get pregnant, I come back. Again, you give me the services. Again, the other month, I get pregnant and I come back. No, it's just so
Yes,
no, I'm
yes,
still
yes.
asking.
Go ahead, go ahead.
Giving the services, they're giving the services, so it's for free. Yes. So I feel like when I grow up now, I get married, I start having complications with childbearing. So what is the MOH doing in order to help the teens with that?
We're having a panel that's coming right up.
All right. Quite interesting question.
Ask it at that point. Because
Veronica?
Yes, and she's going to be there, so you can ask a question directly. Okay. Madam, I think you can proceed and answer that. I've gotten different guidance to say you'll be right at the panel, so we can have the other questions answered at that point.
Okay, thank you so much. So ideally, in a very systematic way, the moment you come to the health facility seeking for the moment an adolescent or young person comes to the health facility seeking for an abortion service, it will not just be offered without counseling. There's counseling that takes place. So once you've had that pregnancy and you don't want it, we know that definitely you were not ready for it. So you are advised, should it be performed, you are advised to start using contraceptives because you have to prevent subsequent pregnancies. We know that young people sometimes abuse services, that I should say. Like the way young people are abusing the morning after pill, right? We know there's emergency contraceptive, but you want to make it an everyday thing. So why don't you use a long-term contraceptive and like always rushing for an emergency when you know you are in this? Similar sentiments have been observed around abortion. Young people have just used it as a contraceptive. In other words, you get pregnant, you know you go and get. But ideally, you are counseled. And if you are not heeding to the counsel, it means the problem is with you as a young person. Because you've been advised, you've made this mistake once, you say, I wasn't ready for this pregnancy. It was just a once-off. Quite all right, yes, we understand. You are offered the service and you are counseled. For you to prevent this to happen again, you need to do ABCD, take care of yourself in ABCD. But if you do not heed yourself, would that be the provider's problem? No. So the issue is every client is counseled to ensure that they take the right way the next time and definitely prevent subsequent pregnancies. But we know that behavior change is something else that cannot be, predicted. Some people just changing behavior is something else. But so, I mean, the ministry is doing all it has to do in terms of counseling across all services, just like even contraceptives. You won't just arrive and you are given this. You have to undergo some counseling and ensure that you get the appropriate contraceptive method that will suit your behavior. So if you know you are sexually active, you are better off getting into a long-term contraceptive prevention measure. At the end of the day, be aware that there's HIV, there are STIs, of which that family planning or contraceptive will not resolve or protect you from that. So the dual protection, we talk about condoms, and this is why we keep talking about condoms. Whatever method you use, a condom has to be there as well, so that you are protected from STIs, you are protected from other diseases and pregnancy as well.
A round of applause for MOH. Thank you so much, Ministry of Health. If we have any other questions, we are within our right to follow Ministry of Health during tea break and lunch and keep on interacting. So what we are going to do now is we are going to do our recap. Do we remember instructions for our recap? So today's recap, Zambia and Zimbabwe. Do we have Zambians in the room, by the way? Zambians, do you remember the instruction? So, because as Zambians, we know how to take care of our guests, we'll let Zimbabwe go first. So Zimbabweans, if you know you are Zimbabwean by heart, by identification, by tribe, by anything, come to the front. If you know you are Zimbabwean by heart, by identification, by anything, please come to the front. Zimbabweans. These people. Now wait for the instructions. You see that these people are a problem, huh? No wonder it gives Zimbabwe. So what we are going to do is very simple and straightforward. You are going to teach the lovely audience a dance, a native dance in your country. You pick a song, you do a dance. After the dance, 3 key takeaways from yesterday. Are we together? So what song do we want there? Someone to go there and play a song. To everyone in the audience, please participate. We are together. I hope the honorable can also participate in the dance. You want to lead? Please.
Okay, DJ, wait, DJ. Okay, so everyone, we need you to participate in this dance. This is going to be a regional dance, but it was originated in Zambia, in Zimbabwe, sorry. Okay, DJ, give us the song. Everyone, you can stand up. You can stand up. Stand here. Let's go. Let's go. Let's go, guys. Now, a round of applause for Zimbabwe. A round of applause for Zimbabwe. Thank you so much, Zimbabwe. Thank you so much, Zimbabwe, for that hype. Now I need 3 volunteers, 3 takeaways. 3 volunteers, 3 takeaways, key takeaways. Anyone to start? You can start.
I still have to catch my breath. So Kokanandanyura means what if I have fallen in love? What have deep in love? So we are saying we have fallen deep in love with adolescent health matters. Good morning to you all. My name is Bridget Mbondiani. I'm from Zimbabwe. My key takeaway points are going to be from the breakaway sessions. I attended the climate session. It was a very interesting discussion that we had. And I think the main key takeaway was that we also spoke about moving forward to the future of the summit. What is Africa also going to contribute as a region? Because we were saying that in terms of climate change,
Watch out for the cables. Watch out for the cables. Watch out for the cables.
Spread out. Let's please spread out. We can spread out.
Wait for instructions. Zambia Kwisa. Now those are my people. Those are my people. So instructions are always part of the exam. We do it. We teach everyone in the audience a dance. After that, people doing takeaways. What dance are we teaching them? What dance? Baba. Baba. That's the dance.
Can we push
That's
back?
the dance.
Can we please push
Okay,
back?
please move behind. Just move behind. We are teaching them Baba.
Please push back right behind that table.
You want to? We should agree. Please agree.
There, perfect. All right. Please watch out for the cables as well. Okay, I guess it's giving what? What? Yeah, it's giving what?
Okay, so what dance are we teaching them? Baba. Baba. Mr. DJ, please play Baba and let's teach the audience the Baba song. Remember, after the dance, 3 takeaways. We are together. Mr. DJ, are we ready?
My co-chair.
Yes, please.
My co-chair.
Yes, please.
My co-chair.
Yes, please.
You are a Zambia, a Zambia.
I'm here.
I see you there.
Come on, I'm here. DJ, let's go. Thank you so much, Zambia Kwisa. Time for recap. Time for recap. I need 3 people.
3. Can you please come to the front? Second person. Come. You want to give a recap? Please, important. Right. So, okay. Settle down. Let's catch the recap from Team Zambia.
My name is Sheila Katongo. I'm from Western Province. So yesterday I was in the HIV prevention station, and I learned about HIV prevention methods, PrEP. Okay, let's say if you know, a person is scared of having HIV, but they're kind of sexually active, or know that they're engaging themselves in those stuffs that can lead them to getting the virus. There is hope of PrEP, because those people who are engaged in those activities can actually take PrEP to prevent themselves from getting the virus. And let's say in emergency situations like rape and other emergency situations, let's say maybe you have been raped and you are scared of getting, you're scared that maybe you have gotten the virus, or just scared of other STIs.
Has become something that people are not afraid to talk about. So we as adolescents, the more we share the information about HIV and AIDS, the more we are going to fight the infection, and everyone will live happily and healthy. Thank you.
Awesome, awesome, awesome. All right, before we go, we have one more.
Hello, I'm from Zambia. Okay. Okay, so it's like most of us were in the same the room break yesterday. We're talking about HIV. But as you know, in Zambia, most of the deaf community, they are limited in access to information on these preventive methods on HIV. So as a young people who was there, I would take what I learned into deaf community. So I will come in from what my friend has said. So for us, we are limited in accessing information. We don't know what is PrEP, what is PEP into sign language, because even when you go to the hospital, we don't have access to sign language interpreters. So it is really a challenge, and a challenge for us who are deaf people, because we do not have information to, there's information.
Awesome. Round of applause for Zambia.
Zambia Kwisa. Zambia, we can go and take our seat. Thank you, sir. Thank you so much, Zambia. Round of applause for Zambia.
Round of applause.
Zambia Kwisa. Rahai Kwisa.
My co-chair, you need to teach me what you're saying.
So, Gloria, Kuchalo means to the world. So, Kuchalo is to the world.
Kushalo.
So, as Zambians, whenever anything happens, we say that thing to the world.
So let's ask our guy.
Yeah.
Hi, Kushalo. Again.
So what we are going to do now is that we are going to have a working tea. What we are going to do now is we're going to have so quickly your tea, and then you come right here, and then we'll continue our program. But before that, I will ask our Honorable Member of Parliament and the board chair and all the other invited guests to use our VIP exit and go into our room setup so that you can have your tea, and then you can join us back. Thank you so much. And then for the team here, the hotel yesterday complained that we all went together and it was very overwhelming. So we'll be going, the guys in the back will go, and then when they come back, the guys in the front will go. But the Honorable Member of Parliament, Veronique, the Honorable Member, you can lead them out. So the colleagues in the back, you can go and have your tea first. The colleagues in the front, you can wait.
Representing Vofa in Zambia, Rahai 2023 hashtag prevention is bad. How are you? Keep Zimbabwe, regional health and health Indaba, hashtag prevention is bad. Murishani, how are you? Presenting Rahai 2023 hashtag prevention is bad.
What is our intake out from the Indaba 2023 as Bofa Clinic or Botswana is that we are here to benchmark so that when we get back down there, we have to take down the policymakers, which are the ministers, the parliament, the government itself, and also the sponsors, so that we get to engage youth, so that we get to eliminate these new infections. When we get to engage youth, that means we're going to win this, so that we get to know the challenge that they're facing for them to access these SRH services.
A key takeaway from today is that young people are ready to do what it takes to prevent the spread of HIV, and that they are willing to partner with government and various institutions. But more importantly, these institutions must not only speak to the young people, but they must also be willing to listen and be joint partners in this initiative.
so happy to be here because Zambia have also included persons with disability in this event. When I go back to Zimbabwe, I'm also going to share what I learned from Zambia with my fellow persons with disability and also youth without disability to teach everyone like sexual reproductive health.
Going back home, the regional adolescent health Indaba has opened up my eyes to what young people can actually do within their country. So going back home to Zimbabwe, I'd like to urge all the young people in Zimbabwe and in Africa in general to say that as young people, we've got the power. If given the platform, we can really do amazing work. I've been impressed with what I've seen in Zambia, and I think it should cascade to all the other countries because if you come together, we really bring out something beautiful and we can sustain the response.
My key takeaway from this exciting moment was this: meaningful youth involvement is very important, especially for young people with a disability. Everyone is important. When we say leave no one behind, make sure that you are not leaving young people with a disability. And for Team Zimbabwe, what I want some youth in Zambia to learn from us is that include young people with a disability in every programming. When you're putting information, put it in Braille. When you're doing outreach programs, put it also some people who do sign language. It is important. When we say meaningful youth involvement, involve young people with disabilities.
Representing Vofa in Zambia, Raha 2023. Hashtag prevention is bad. How are you? Team Zimbabwe, Regional Health Adolescent Health Indaba. Hashtag prevention is bad. Mulishani, how are you? Presenting Raha 2023. Hashtag prevention is bad.
What is our intake out from the Indaba 2020?
My name is Louis Mercy Katoka, and I'm the country youth representative on the Mosaic project under FHI 360. So we are partnering with ZYP at the 3rd edition of the Regional Adolescent Health Indaba being held in Lusaka, Zambia at Mika Convention Center. And we're just here to exhibit the work that Mosaic does with regards to meaningful youth engagement and the participation of young people in matters that affect them. My biggest takeaway from the 2023 Indaba is meaningful youth engagement has to be taken to the next level, in that youth should be involved in all processes, in everything, starting from inception all the way up to service delivery and implementation. We don't just want to sit or be consulted for advice, but then we want to really take part and not just sit on boards or be invited to events as tokens. And we also want to see key stakeholders like the religious leaders attend these Indabas so that we're able to discuss matters of adolescent health and programming even in the church setup. My name is Louis Mercy Katoka, and I'm the country youth representative on the Mosaic project under FHI 360. So we are partnering with ZYP at the 3rd edition of the Regional Adolescent Health Indaba, being held in Lusaka, Zambia at Mika Convention Center. And we're just here to exhibit the work that Mosaic does with regards to meaningful youth engagement and the participation of young people in matters that affect them. My biggest takeaway from the 2023 Indaba is meaningful youth engagement has to be taken to the next level, in that youth should be involved in all processes, in everything, starting from inception all the way up to service delivery and implementation. We don't just want to sit or be consulted for advice, but then we want to really take part and not just sit on boards or be invited to events as tokens. And we also want to see key stakeholders like the religious leaders attend these Indabas so that we're able to discuss matters of adolescent health and programming even in the church setup.
My name is Taitu, aka Big Boy, and I'm an artist from the Big Z, Zambia. I came through for this youth Indaba, ZYP, Summer Youth Platform. For me, it matters most to see how young people get to conduct themselves. There's things that I know that affect a lot of young people, because being in the music industry, there's so many things that we're exposed to, so many things that I have personally survived because of bad decisions, be it the alcohol, be it drugs, be it the parties, be it women, and I'm still alive today. There must be a reason and purpose. Key takeout from this whole thing is I love the energy from the young people that came through, and you know, just the fact that so many people came together to want to save lives of nations, because at the end of the day, even in the Bible, it's not just a baby, it's nations through that baby. So one person that you have a conversation with, you save one person, you save a nation, because they will pass on that message. So yeah, this message coming from me to you with so much love. Yeah, take care.
Involver in Zambia, Raha 2023, hashtag prevention is bad. How are you? Team Zimbabwe, Regional Health Adolescent Health Indaba, hashtag prevention is bad. Mulishani, how are you? Presenting Raha 2023, hashtag prevention is bad.
What is our intake out from the Indaba 2023 as Buffer Clinic of Botswana is that we are here to benchmark so that when we get back down there, we have to take down the policymakers, which are the ministers, the parliament, the government itself, and also the sponsors, so that we get to engage youth, so that we get to eliminate these new infections. When we get to engage youth, that means we're going to win this, so that we get to know the challenge that they're facing for them to access these SRH services.
A key takeaway from today is that young people are ready to do what it takes to prevent the spread of HIV, and that they are willing to partner with government and various institutions. But more importantly, these institutions must not only speak to the young people, but they must also be willing to listen and be joint partners in this initiative.
So happy to be here because Zambia have also included persons with disability in this event. When I go back to Zimbabwe, I'm also going to share what I learned from Zambia with my fellow persons with disability and also youth without disability to teach everyone like sexual reproductive health.
Going back home, the Regional Adolescent Health Indaba has opened up my eyes to what young people can actually do within their country. So going back home to Zimbabwe, I'd like to urge all the young people in Zimbabwe and in Africa in general to say that as young people, we've got the power. If given the platform, we can really do amazing work. I've been impressed with what I've seen in Zambia, and I think it should cascade to all the other countries, because if you come together, we really bring out something beautiful and we can sustain the response.
My key takeaway from this exciting moment was this: meaningful youth involvement is very important, especially for young people with a disability. Everyone is important. When we say leave no one behind, make sure that you are not leaving young people with a disability. And for Team Zimbabwe, what I want some youth in Zambia to learn from us is that include young people with a disability in every programming. When you're putting information, put it in Braille. When you're doing outreach programs, put it also some people who do sign language. It is important.
Bring them in. Take your seat in the panel. So you sit on your opposite side. Yes.
Thank you, man.
So you hold. The board chair of what? Right.
Dumela, hello, we are from Botswana, representing Bofa in Zambia. Rahai 2023, hashtag prevention is paid. How are you? Team Zimbabwe, Regional Adolescent Health Indaba. Hashtag prevention is paid. Mulishani, how are you? Presenting Rahai 2023, hashtag prevention is paid.
What is our intake out from the Indaba 2023 as Buffer Clinic of Botswana is that we are here to benchmark so that when we get back down there, we have to take down the policymakers, which are the ministers, the parliament, the government itself, and also the sponsors, so that we get to engage youth, so that we get to eliminate these new infections. When we get to engage youth, that means we're going to win this, so that we get to know the challenge that they're facing for them to access these SRA services.
A key takeaway from today is that young people are ready to do what it takes to prevent the spread of HIV, and that they are willing to partner with government and various institutions. But more importantly, these institutions must not only speak to the young people, but they must also be willing to listen and be joint partners in this initiative.
So happy to be here because Zambia have also included persons with disability in this event. When I go back to Zimbabwe, I'm also going to share what I learned from Zambia with my fellow persons with disability and also youth without disability, to teach everyone like sexual reproductive health.
Going back home, the Regional Adolescent Health Indaba has opened up my eyes to what young people can actually do within their country. So going back home to Zimbabwe, I'd like to urge all the young people in Zimbabwe and in Africa in general to say that as young people, we've got the power. If given the platform, we can really do amazing work. I've been impressed with what I've seen in Zambia, and I think it should cascade to all the other countries, because if you come together, we really bring out something beautiful and we can sustain the response.
My key takeaway from this exciting moment was this: meaningful youth involvement is very important, especially for young people with a disability. Everyone is important. When we say leave no one behind, make sure that you are not leaving young people with a disability. And for Team Zimbabwe, what I want some youth in Zambia to learn from us is that include young people with
Hello, hello, young people in the room. Good afternoon, young people in the room. Oh, it's still morning. You know, when you are having very, very good conversation, time tends to fly so quick. So we are going to be having our panel discussion now on sexual reproductive health rights and adolescent health. And I'm going to give this time to our panelists to please introduce themselves and the work that you are doing towards sexual reproductive health rights and adolescent health.
Good morning, everyone. My name is Nsofwa Petronella Sampa. I'm a person with a disability. I'm blind and deaf in my right ear. My work focuses in sexual reproductive health. I work in ensuring inclusive programs and projects are done for persons with disabilities. I'm also part of the technical working committee under the national level, and I represent persons with disabilities there. I also run an organization called Positive Movement. So tag us on Facebook if you can.
Good morning, everyone. My name is Moses Soko. I'm deaf from Zambia Deaf Society. I'm the president of that organization. My work is to advocate for human rights for people with disability and focusing on deaf people. Thank you so much.
Good morning, everyone. My name's Oscar M. Nyaiwa, and I am a pastor. And I am the board chairperson of the youth platform. And I guess all of you guys being here is a testament to what I am doing toward health, I guess.
Good morning once again. I'm Mabel Mwemba from the Ministry of Health. I coordinate the Adolescent Health Program. So SRIH, targeting adolescents and young people, is something I do on a daily basis. Thank you.
Good morning, everyone. My name is Stephanie Rosso. I am the Programs Advocacy and Learning Manager at Transbantu Association Zambia. TBZ is a transgender and intersex organization that creates an enabling environment for trans and intersex people within the country. Thank you.
Good morning, everybody. My name is Natasha Ivy. I'm the Gender Research and Human Rights Officer at Transbantu Association Zambia. And like my colleague said, we primarily work around transgender and intersex folks. But for this particular session, obviously, we're going to be talking about adolescent and sexual reproductive health for trans diverse persons. Thank you.
Thank you. So these were the introductions from the individuals we'll be having the conversations with today. And from you, the young people, as we all are by the majority in this room, the one thing you should take keen note of is for you to listen and pay attention. It is only when you listen and pay attention that you'll be able to ask the exact questions to get the exact answers that you want. Now, we're extremely anticipating to have the honorable present in this conversation today because of the line of the conversation that we're having. But to begin with, because we have representation from MOH, I think our question is, what are we doing currently? How has been the progress since last year when we had the regional Indaba? What stride have we made? How far have we come? And how exactly is that reflecting today?
Okay, we have made quite some good progress based on your question. From the last time we were here last year, I might not have the numbers, but you know that last year districts were not involved that much. In terms of there are high, these have been high level, national level. But then where are you young people coming from? You're coming from the respective districts. This is where our former minister had pledged that as government, we take these discussions, these dialogue meetings that we have, these indabas to the local levels, to the grassroots, where you young people are coming from, and where the stakeholders that are surrounding you are equally coming from. So we have scaled that. For this year, we're proud to report that 40 districts had the indabas. And besides just the Rahai, across the country, we have partners that have come on board to support us with dialogue meetings at community levels. With the support from the Global Fund, we're implementing a program we call the Adaptive Leadership that is similar to this. It brings together different stakeholders to discuss the issues that are affecting young people in the and that's different stakeholders includes parents, young people themselves, religious leaders like my pastor on the right. You all sit at the table and discuss, the genesis of these problems that we are seeing among young people, the issues of new HIV infections, the high teenage pregnancy rates. We discuss why do we see this in our communities and how can we work together to end this. So everybody takes responsibility, everybody identifies what they are able to do in order to end that particular problem. So we've done quite a number of interventions working with different stakeholders.
Thank you very much. I think following that, I'd also want to ask a question to the other present supporting partners and organizations to say, in your line of work with SRHR and adolescent health, what would you say are some of the opportunities and the gaps that you have notably made so that moving forward, we know what it is exactly that we need to address? So we are asking, in your line of work relating to SRHR and adolescent health, what are the notable opportunities and gaps that you have realized that could perhaps help us in moving forward to know what then we could address?
Thank you very much for the question. Okay, I want to thank you, the Minister of Health, for being here to hear from us. When it comes to deaf community, they face challenges when it comes to accessing health services. Reason why? Because it's hard to communicate with health workers. The first time the deaf person goes there to access health services, you'll find that it will be hard to get the quality health which one can get. For example, it's so some positive contribution which the Minister of Health have introduced is including now a curriculum when it comes to sign language, so that health workers can learn some basics which can contribute to deaf community to access the services which everyone are accessing. This is developing in our community. Now you'll find that many health practitioners. It's hard now. Again, we will find that there is a curriculum, but once you go to the hospital to access the SHR, it will be hard for us to discuss with a health worker. So I think it's need more work so that this curriculum can be implemented. We are seeing some health workers are able to communicate with deaf people, but we need more work so that we can see deaf people are getting quality health in health services.
Thank you very much. I think from last year to this year, there's been a lot of I've seen, well, not seen, but I can attest to the fact that there's been a lot of improvement. I'll start with the fact that we've actually been recognized as persons with disabilities in the strategic plan. I think there's been a lot of strides, and even when you go to the facilities now, compared to the past, we are seeing persons with disabilities going to the facilities more as it was in the past. Young people couldn't go to the facilities because it wasn't accessible. You find there are no ramps, but now they've started building some ramps. Not all facilities have them, but at least a number of them have started having ramps in their facilities, especially at the youth-friendly spaces. Also for the blind, we've seen some braille materials being printed for them to read. Not that that's the only thing that they've done. We've also seen healthcare providers improving in the way that they welcome us. In the past, they would talk to the ed instead of talking to me, the person with a disability. I'm seeing a lot of improvement because I would actually, last week, Friday, I visited one of the facilities and I was with a guide. I went with somebody. They actually asked me if I wanted to have the person in the meeting, which I think is good because then I can be confidential with whatever I wanted to discuss with the healthcare practitioner. So in terms of opportunities, I think going forward from the past and today, I think there's been a lot of improvement in the areas of accessing SRS services for persons with disabilities. And I think going forward, if we continue in the way that we are moving, looking at following the strategic plan and even just the amendment that government has been working towards in terms of improving persons with disabilities healthcare services, I think in the next 3-4 years, I think we'll have an inclusive environment like we are aiming for.
All right, so basically right now I'm wearing two hats. I'm wearing the hat of a religious leader and the hat of board chair for the youth platform. I'm gonna speak first of all as the church. I think the challenges in the church, there are very few people that are bold in the church. It takes boldness to discuss matters of sexual reproductive health. I think the church has done so good when they have camps, they've talked about health, they've talked about hygiene, but they've never delved into the sexual reproductive health. But I think a few of them are coming up. There's a curve that is going on currently because as the youth platform, I think we're beginning to engage pastors, making them realize that actually if young people will not get information from your church, they will get the information elsewhere. And when they get information elsewhere, we are actually creating a disaster. And I think in terms of opportunities for the church, I think health practitioners and people that work in the civil society, most of them are actually in churches. I think that's a great opportunity when we have youth camp meetings. Why don't we have these health practitioners coming and offering not only services, but information first, because information has to get in so that people begin to change their mindsets and beginning to accept. The Bible tells us that actually God wants us to be both wealthy and healthy. And I think the church has taken so many steps in preaching about wealth, how you need to be wealthy, but they've forgotten the healthy part, because you cannot enjoy your wealth if you are not healthy. And therefore, this is a challenge to us, I think, as clergy, to be forthcoming and open enough to realize that if we are not open to having discussions with young people about their sexual reproductive health, we are actually creating a very problematic society, and we'll be losing young people to STIs. Let me give an example of what happened to me. One time, one of my youths came up to me and said I needed to pray for her sister because she had some mucus coming out of her private part. I said, I am not going to pray because of what I do, okay? Because of the exposure that I've been given. I said, we're not going to pray. We're not going to waste time talking to God and asking him to heal. Let's find out what this is, because I believe personally that must be an STI. So if you go to the clinic, they're going to sort it out and we'll give God a break. We don't need to have God sorting problems that we can be sorting out. And believe you me, she took her sister to a clinic and the problem was sorted. We didn't need to pray. So I think it takes boldness for me to say what I'm saying and for me to tell my member that, because as preachers, especially young papas, everybody wants to be known as the healer, you know. Come and buy my water, come and buy my this because I'm going to heal you. Come on, that's crap, dude. Go to the clinic. Go to the clinic and get help. All right, go to the clinic, get help.
So in terms of progress that has happened within the spaces for transgender intersex people.
Colleagues?
All right, so in terms of progress that has happened in terms of access to services for adolescent, transgender, and intersex people, but broadly speaking, key populations, I think first of all, the recognition that transgender people are key populations within the National AIDS Strategic Framework was a goal. That has been able to enable funding, whether it's from key population investment funding or global fund, to reach key population organizations to be able to implement across various districts within the country. And so because of that, we've been able to work with local authorities, like the PACA's office, the DACA's, the PHO, the DHO, the DHDs, in creating awareness within these communities about transgender, intersex, but also broadly speaking, key populations. And then also we've been able to raise awareness among the healthcare providers about providing prejudice-free health services to key populations. Opportunities, I think because of the community-led monitoring processes that have been happening within the country, there are different methodologies that are being used, but particularly Transbantu has used one, which we're calling setting the levels. So we engage with the communities themselves on documenting their experiences as they access healthcare services from these facilities that provide prejudice-free health services. And we are rating them based on affordability, accountability, accessibility, availability, and quality. A number of times when we're engaging with people who we call recipients of care, many times their voices are left out of the cascade in terms of the feedback that they perceive when they're accessing health services. We also engage with the healthcare providers to also rate their facilities. So it's a two-pronged methodology where the facility rates itself and the key populations also rate the services that they receive. We also then now have a dialogue about what can be improved within these facilities when it comes to accessing health services. So that is shaped by the communities themselves. This is how we're including them in the design. And then implementation, we also have key populations serving as community health workers or peer navigators within these different facilities, also then acting as focal point persons for other key populations to feel comfortable and confident enough to go and access the service from that facility. Then also in terms of monitoring, we have a platform that we call MaBox. So MaBox is a feedback platform where individuals who've accessed this can drop information about what the service is that they received. I think this also serves as an opportunity for us to scale up within the country for other facilities also to do the same. So MaBox acts like a suggestion box that normally isn't used in health facilities, and communities are able to meet with a peer monitor or a focal point person at the facility, document their experience. If they want follow-ups, this will be done because they'll state it within that platform that they're giving the feedback on. And this has been able to help us share information with the healthcare providers by doing a data analysis process. So again, communities are brought back to the fore to have a conversation about the data that has been interpreted from the Mabox platform. And we also have this conversation with different stakeholders, not just healthcare providers, the UN bodies and other agencies that might be interested, including National AIDS Council. And then from there now, we interpret the data and have conversations with the health facilities through a process we call a better place. And so here we're negotiating with the healthcare facilities on what it is exactly that can be done to remedy the issues that have been documented. And we can say safely that through interactions with UTH, for instance, we've been able to see tremendous change when it comes to accessing services for key populations in that regard. Thank you.
Thank you so much, Stephanie. I think they have alluded to the fact that KP programming has scaled up over the past few years. And so that has enabled a lot of young people who are from the KP movement or community to be able to access services that are less discriminatory and that are less stigmatizing in the sense. However, I would like to also contribute to the fact that we have been given a policy, a framework, a national AIDS strategic framework that guides the work that we do. So our work is acknowledged even by Ministry of Health, but also, institutions such as PEPFAR, CDC, and the Global Fund also have provided that kind of support in terms of application of some of these services. Also, some of the opportunities are the work that we have been doing with different UN bodies. In 2019, we were privileged enough to participate in a process that was called Linking Policy to Programming that developed a legal environment assessment tool that was highlighting specific key population issues for adolescent health for young people within the KP programming. But also, I think something that we need to also take advantage of as young people is to explore different other regional and international mechanisms that affect SRHR for young people in Zambia. For example, we participated in a process called the Universal Periodical Review that most of you might know of. And during the review process of the country in January, some of the highlighted issues around SRHR for young people came out. With regards to sexual gender-based violence that happens because of issues around corrective rape that some of you might be familiar to, but also issues around non-consensual genital surgical interventions that happen in health facilities for intersex persons. And so also that conversations has led to a resolution called Resolution 552 at the African Commission on Human and People's Rights that has urged all states in Africa to ensure that such protocols are implemented in country to avoid issues around non-consensual genital surgical operations. And so, in partnership with Ministry of Health, where we're waiting for confirmation from Ministry of Health to sign off, but in partnership with the Human Rights Commission, in partnership with the UNDP, an intersex protocol is being developed to acknowledge some of these things in terms of managing intersex persons in health facilities. However, I would like to point specifically about the gaps because we're talking about being bold in the room. And so a gap surrounds issues around when it comes to access, right? Issues around misinformation, misapplication, misrepresentation, and misinterpretation of the law. And so that then increases issues around misinformation, and then
conversation as you are informed in the church setups. What is Ministry of Health currently doing in response to the gaps that have been identified and highlighted in this panel?
Okay, so that's pretty easier for me because I think all the stakeholders that have spoken have already alluded to that. With the gaps that are being identified, the solutions that are being applied. So there's the issue of capacity building of service providers to ensure that the person-centered, responsive in terms of providing services, regardless of who the person is who is sitting in front of them. Let them provide the service that meets the needs of that particular person. And then when it comes to the issue of, the health system, this is a broad issue that borders around guidelines and policies that are in existence. We recognize right now that we have the National AIDS Strategic Framework that recognize the key populations and clearly stipulates what should be done in that area. So that is inclusiveness and helps to give guidance to the public health system in terms of how they provide services. So policy direction, there is guidance that is there, and the gaps are well noted, and solutions are being applied. So we should, the same challenges that are faced on the other side are the same challenges that could be faced generally on adolescent health. So what limits speed implementation, it all comes back to resources. How much, if we have all resources, would ensure that every healthcare provider is provided and is trained and capacity built in providing adolescent-friendly health services. They are trained to provide key population-sensitive services and inclusive services. They are trained in sign language to ensure that we are disability inclusiveness. So if we have resources, we'll do everything everywhere, but working with partners across the country, we are trying to. And one platform that we use, I'll speak for the adolescent health program, is the National Technical Working Group, because that helps us get to map which partners are operating where, and we lobby for resources such that wherever the partners are working from, they help us provide capacity at facility level, at district level, to ensure that the health services are provided in a person-centered manner and not just grouping everyone. People have different needs, and therefore they will seek services based on the individual needs. And our system, our role is to provide responsive health services to respond to the needs of individual people. Yeah, thank you.
As we are summing up our discussion, I would like to also ask, moving forward, what opportunities do you have for the young people in this room in your programming so that they also become part of the solutions? Because as we young people always say, there's nothing for us without us. So how can young people also join in within your programming so that they're part of the solutions?
So when it comes to opportunities, I think as for now, so parents and relatives for people and children with disabilities, specifically deaf, they need to know sign language so that it can be helpful for them to access. In fact, for example, Minister of Health, they have done a good job by allowing us deaf people, teaching health workers to know how to communicate with deaf people. Because way back, we are facing challenges to access these services. But you'll find that at home, the deaf child is failing to communicate with the parent. Why? Because the parent don't know sign language. So it's important we are begging that even the community parents need to start from home. They need to know sign language so that it will be easy for that child to communicate when the child is sick and when going to the hospital, because the health minister of health, they have introduced sign language, so it will be that like that. It will be easier for us. Thank you.
For me, I believe charity begins at home. If parents are not having conversations about disabilities in homes, are not having conversations about HIV, it's difficult for the community to stand up. So for me, I believe that the only way we'll get there is if we start having these conversations. It's very difficult for a person with a disability to relate with somebody without a disability because they feel inclined around their fellow friends. I did a research last year, and most of the conversations we had with the persons with disabilities were more open to talk to me because they knew I had a disability than with my colleague. So you find that if we could find, even in the health spaces, there could be a trained peer educator with a disability. It will encourage others to also come to the facility and learn more. So we need to start having more people being trained in facilities, in the communities, but it still goes back to what conversations are we having with our parents in the homes? Am I being hidden in the house because I can't, because I am blind? You know what I mean? So it has to start from somewhere. If parents don't let their children come out, healthcare providers won't know how to help persons with disabilities. So we need to start letting these people come out so that they get to learn. The church has also spoken. We also need to let them be active in the churches, in every sector where persons with disabilities are present. They have to be present. So for me, I think my way forward is let's engage persons with disabilities at every angle. Let's not look at the disability, but look at the abilities of a person with a disability. Thank you.
Thank you for actually making my job more easier. I can say a few things. I think basically for me, I throw the challenge to everybody that is in the room right now, especially for those that are in Zambia. There's about, I think, 7 million others that are not in this room, but they are part of our village called Zambia. And if we keep the information and if we keep the activities happening in here to ourselves, then we are doing ourselves a disservice. I think, like my two colleagues have said, we need to be discussing these issues in our homes, with our parents, with our colleagues, with our pastors. I give you a challenge, please. As you go back home, go talk to your pastor and tell them about the stuff you learned here and ask them about their views concerning them. Sit with leaders in the church, ask them and tell them, these are some of the things I have heard, and these are some of the things I'm going through. Let's be open and let's have an open discussion so that we can actually let the movement viral. If it ends in us just having meals and having a great time, having pictures in this place, and then wait for 12 months and gather again in this place, then we are literally doing ourselves a disservice. I would love for us to go back and challenge our pastors. Actually, invite your pastor to this next year. Edie and I'll ask Edie to give the permission that your pastors should be part of this conversation for next year. Thank you.
Myself.
I think for Transbantu, numerous opportunities exist for a lot of young people, even within this room. We like to operate by policy we call each one teach one, similar to what has already been mentioned. So we identify different key populations through a snowballing effect, where you know someone who knows someone who knows someone. Let them be a part of the conversation. When we go back to our different spaces, I keep hearing somebody from Western Province introducing herself and articulating herself. We also are based in Western Province, and it's nice to know that there's someone from there who's also represented in the audience here. And that means also that we'll have an easier task when it comes to informing and in reaching out to key populations. But we also interact with AGYW, that's adolescent girls and young women within the Western Province space and in Lusaka. There's numerous opportunities, like I mentioned, either through sports, either through trainings, and even through employment, because we are implementing key population investment fund projects across 2 different districts within the country. So I think for me, there's multiple opportunities for us to collaborate. And also the mere fact that with TBZ, we are not just interested in key populations, but we're interested in any person who's willing to be a change maker or a change advocate to change the paradigm for trans and intersex people, but broadly speaking, key populations. So we'll be happy to take you on. Thank you.
Thank you. Specifically, I think it's important that we invest more in research. I think there's a gap in that when it comes to our adolescent health work. Intentional integration of gender issues in adolescent health, I think that's important and an opportunity for folks in the room. Again, also exploring regional and international mechanisms to enhance domestic remedies in terms of building capacity of young people to engage in those mechanisms. That's an opportunity. But also integrated resource mobilization. I think these days partners want to see coalitions and collaborations, and I think that's also an important opportunity for us in terms of resource mobilization, but also participating in a community-led centered monitoring process so that now we can begin to have conversations around quality insurance, quality improvement of healthcare services for young people, but also creating positive and sustainable partnerships with public health institutions. It's also an opportunity for us as young people to begin to look into strategically and deliberately. But again, I think my colleague had mentioned intentional expansion. I think services should not just be urbanized, but we should also create spaces where young people can access services in the deepest part of rural areas in Zambia. Thanks.
Nice program. Most of our adolescents don't want or are scared of getting pregnant. They like family planning once they have accessed the family planning. They have unprotected sex because they forget or they don't care about STIs. So we have a big task ahead. We have to take the information about how dangerous STIs are so that these adolescents will stop having unprotected sex because they are informed thereafter. And the young people, I know we are informed, but I hope we are also taking Sophos' words by saying charity begins at home and are not using this information for our own personal benefit. Going forward again, we have it's Nelly Lopez. Oh, okay. At least we can't wait it to reach every town so that people living with disabilities can be taken care of. I think this comment is in response to exactly what's the conversation we're having here. Nelly also says, I'm loving the topic of discussion. She also adds that can TYP also involve churches, at least 1 or 2 youth leaders to attend such meetings? Then we are going to move as one, like the way health workers go to each other and every church to talk about a breakout, and we can also do the same. I think primarily because we have the culture wearing 2 hats here, it's a good start. And also that he had also mentioned he's a young papa. So I think the church, in as much as he mentioned that the clergy are important, going forward, as he promised to have a conversation with ED, that would definitely be seen. Nelly also adds, truly they need to know how to communicate in sign language, and health providers also need to know. I think that's why the comment ends. I think generally also speaking to the concern that we had from MOH, there's definitely need for more funding that these issues can intentionally be addressed, because they are definitely key priority issues. So more funding. I hope we're also having budget conversations around how best we can prioritize these things when it comes to funding, that we can have people or persons with disabilities, where we can have materials and conversations going around that they are informed. Colleagues, it's been a wonderful conversation that we just had, and I hope that you enjoyed it as well. Thank you so much. A hand of applause to the panelists. Thank you so much. Yes, the panelists can now take their seats. Thank you so much for coming through. We appreciate you coming. Thank you so much to Bridget T as well. You've been a great co-moderator. Lovely smile. Thank you.
Another round of applause for that wonderful panel. I hope you learned 2 things. So, right about now, I have a surprise. Are you ready for the surprise? I can't hear you. Are you ready for the surprise? Rahai? Mr. DJ, can you play that music so that people can know what the surprise is?
That's it. Pepe no senga niliko. Oh, that's it. Skonde chako nechamende. Oh, yeah, chamane pasa chimwengweneo. Pepe no senga niliko. Oh, that's it. Tia. Skonde chako nechamende. That's it. Bensone faka panse bantu. Bensone nyosa teile monchela. Bensone posa makelo mufeto. Oseko nenzole la maseko. Denala kwata nepone sonda bantu. Nenso sakile temwe mukale. Kosonde wa ene molongo pez. Ne pasa muntu anga ne polomose pameno na ne pesa ne se watwana la pameno na ne pesa ne se wakufa la echa se kuhane unane kwela mutima unane kwela lelo ni sekelela. How's everybody doing? My name is Taitu. Just in case somebody's wondering who this guy is. My name is Taitu, and I'm so happy to be here. I was here last year, and seeing so many young people be part of this means so much to me because anything to do with young people, I want to be a part of. That's how come I'm working with this man here who some people have told him he kind of looks like me. So he sampled my name, TY2, TYP. But in any case, I hope everybody have a good time and really pick out the information everybody is going to share because your life depends on the choices that you make. So let's make positive with everything and God bless. One love.
Thank you so much, Taitu.
One more. One more. Okay, guess what? We'll have one more later. One more later. No, I promise you. One more later. But right now, we want... Okay, so as your conference chair, I have been given the liberty of asking for one more. One more. One more. But we promise we'll make it short.
So you asked for one more. Which song do you want to listen to now? Which one? That's it. Devampele Bamafuna Kupeza Chekonde Chavanga Kampe. This is true love. Oh, this is true love. Koma bena vale pempai. Pamakala beka moyo wabonse. Sekoti bamafuna yai. Pena pe mafuta mema zezeyana. Monga kamumada, monga mumada wamene. That's it. Dia chikonde changa pali weo. Dia mutima wanga pali weo. Mutima chikonti chako. Kecha mene ne mafunda. Deka ni kukundi. Deko konde munjila ya meniziva. Tatetika ya mbochezana. Deva mene ni mafunda labi. Deka ni kukundi. Deko konde munjila ya meniziva. Leka ni kukunde baby. That's it. Deka ni kukunde mami. Deko konde munjila yanga. That's it.
Thank you so much, Tai 2. A round of applause for Tai 2.
Round of applause. Awesome, awesome. So you guys owe me for one more time. I did your one more time. This is what I'd like you guys to do for me because we want to invite the next session to come in. And how we're going to do it, Mr. DJ.
So how we are going to do it? Team Zimbabwe, are we in the house?
No, my co-chair, I don't think I had Team Zimbabwe in the house.
No, I didn't.
No, did you guys hear Team Zim in the house? So Team Zimbabwe, are we in the house?
So Team Zimbabwe, we would like you to come and welcome our next presenter. The next presentation and an interface panel discussion is going to be on universal health coverage. So you remember what we did in the morning? Do you remember what we did in the morning? So Team Zimbabwe, please come to the front, teach us a dance, pick a song, and let us welcome CSEM as they get ready for their presentation. Team Zimbabwe, please come to the front.
Is it going to give Zimbabwe? Is it going to give Zimbabwe? All right, let's go, let's go.
So please hurry up, Team Zimbabwe. CSEM is already ready. We do one quick one, we welcome them. Yeah, so just go back so that you... Where's the flag? We want to see the... Oh, good.
The flag, there you go. All right, please.
Bobby! Right up there! Come on, Zimbabwe. Mume wako marriage katenya wachukua stepagate na champagne na lebo massage katenya white ni mustard. Thank you so much, Zimbabwe. Thank you so much, Zimbabwe.
Thank you so much.
It's giving. Thank you so much, Zimbabwe. System, we are ready for you.
All right, it is our pleasure and honor to invite System, our presenter, is getting ready to come and share with us a short presentation, and then after that, we'll get straight into a panel discussion. So let's settle down and let's give our presenter some ear. All right, it's my honor to welcome Laura. Laura is my colleague at Waki Health and holds fort for CSEM. So I'm not only inviting CSEM, but I'm also inviting a colleague and a friend and a sister. Most welcome, Laura.
Thank you, Gloria. Hi, everyone. I hope you're exciting. I didn't hear anything. Are we happy to be here?
Yes.
Okay, I love the energy. Thank you so much for being present today for the amazing session until now. This is really, really great. We learned so much. And it's such a delight to see so many young people deeply involved in health. So congrats to you all. Without further ado, we will introduce the presentation on accelerating progress of universal health coverage. So my name is Laura Philidor, and I'm from the CSEM for UHC 2030, which is also the Civil Society Engagement Mechanism for UHC. And I know we have several young people in the room right now who participated to our UHC Youth Workshop. I want you to give a round of applause to all of you guys for the amazing work you were doing just 2 days ago. So well done to all. And thank you. And now we are going to have an interesting panel discussion also with some member of parliament who will be there and youth speaker, and you will have the time also to ask questions in the room. And without further ado, I hand over to my colleague Veronique, who will moderate the session and introduce you more about the subject of the topic today.
Thank you so much, Lara. Now, you see how biased these people are. Because it's me, they haven't introduced me, so I'll do my own grand entrance. So as I walk to the pulpit, as we call it at church, amen, when I step, you clap, okay? Go. Let's go. You are not clapping. Clap. Let's go. Thank you, thank you, thank you. So if you haven't clapped, you are remaining in heaven. I see you. All right, so thank you so much. I'm hoping that it's coming. Okay. So hoping that we can go through our program as smoothly as possible. And I know that people are itching to ask questions. So this particular session that Lara has introduced actually kicked off on a Thursday. Can I see the ones that were present in the last conversation for the USG workshop? Only the other table, the other countries, we had different regions represented in the meeting. So we have brought it back today to ensure that it is also covering for those that didn't attend the workshop. Okay, so now just a little bit more to share on universal health coverage. What this means is that all young people need to have full range of access to quality health services that they need. And now when these young people need services, it is very important that they get them as and when required.
and they know where to get them without struggling financially or having any struggles. Can I just see a hand if you're a young person who struggled to have any health access service at the health facility? All of you have gone and you've been given. I can't see your hands. Okay, so we have a couple of hands. So this is what we are trying to push as an agenda to achieving the universal health coverage by the year 2030, that all young people are having access to health services. Now, why are we having parliamentarians today on the panel? It's because they are instrumental in responding to the issues pertaining to young people's health. They also create legislative procedures, frameworks, policies to ensure that some of the things that we are asking about, the questions that haven't been dealt with within systems, are also answered. So without them, there is no way that we can achieve this. All right, so even as we bring them on board today, this is a physical, very interactive place for you. In fact, let me add safe space for you to ask them questions. Let me add before Honorable comes. He works for you. He's here. Oh, okay. I'm in trouble. All right. But the sure thing is that Honorable works for you. So feel free to ask these questions to him. And one of the things I needed to add is that, you know, young people cover a huge representation from all over Africa. We cover up to 1.2 billion in the world for the ages under 25 years. So you see that most of the change that needs to happen, if it doesn't happen, it affects you people. So you need to be in the forefront of asking questions if things are not happening. Also, I'm calling you young people not to only ask questions, but come up with very creative means on how you can also be part of pushing the agenda. So without further ado, I'm going to invite the panelists to come. So we're also going to invite them as they walk. But firstly, I'm going to read their bios. Honorable is here. Honorable Khalil. Oh, okay. Honorable Joseph Tombo. Yeah, welcome, sir. It's still on the table. Okay. Perhaps okay. All right, so I've been told that Honorable Tombo is not in the house. Osanje. All right, so may I invite Honorable Kalila to the stage. Now, can we do the grand entrance for him? The grand clap entrance for him. No, that's not what we are doing. Sir, we welcome you to the stage, but we want to do the grand entrance for you. So as you walk majestically, we will clap according to your steps. Are you ready, Rahai? Okay, so he says he's ready. No problem, sir. So if I turn, you can turn. Yeah. Let's go, guys. 1, 2, 3, go. Can I tell? Thank you so much, sir. Have you seen that? Also, your MPs have got vibe. Thank you so much. All right, so now I'm going to call to the stage Honorable Musanje Joseph, MP. So let's do it for him as well. So this one, you have to add a bit more energy. Are you ready, sir? Yes, we do Parliament Kilo. Yeah. Let's go. All right, can we do the clap for him? Let's go. Are you walking, sir? Until he sits, honorable. Thank you so much, sir. Thank you so much. And I'm going to call to the podium Tandiwe to join as well. She's representing people living with disability. Please, a clap for Tandiwe. Wait. Guys, what is it? Tell me, talk to me. Talk to me. Let's add some more energy for Tandiwe. Let's go. We are working. Can you interpret for her? Come on. Yes. Thank you so much, Tandiwe. I'm going to also invite one more person, one very energetic young person. So, you know, when we were dancing this morning, the dance from Zim, I promise. Can I invite Elliot to come and be part of the panel? Wait. You are very biased. Let's go. Yeah. Thank you so much. All right. Now to kickstart this conversation, I just want to share a little bit more on the summary for what happened in our workshop so that we can put you to speed for those who are wondering what UHC is and what CSEM came to do with the young people. I'll just check if my slides are ready. So. All right, so the slides are not working. We'll allow Laura to go first. Hopefully we can have the screen to go on. Before I share the proceedings from the workshop, Lara will just give an overview of UHC and what's happening around the region.
Thank you so much, Veronique. And as we don't have the slide, let me illustrate the first one. Oh, good. Well, let's do it anyway, because I love the umbrellas. So for this first slide, before we go into the definition, I want to know, is it any inspiring for you, this umbrella? What does it mean? Why do we use it to describe UHC, universal health coverage? Any idea? Yes. A protection? Perfect. Yes, it's exactly it. So whether you work for sexual and reproductive health, HIV, any other health issue, and not even health issue, even for climate, education, all this is included under UHC. We cannot achieve universal health coverage without addressing each of these issues. So that's why we are using the umbrellas. That's the first sense of it. The second is linked to the definition. And I know many of you know the definition right now, and you must be exhausting with us repeating it. But here we go again for the last time. So what UHC means, it means that all people, whether you live in different areas, no matter who you are, no matter your health condition, have access to essential health services of sufficient quality without too much financial hardship. I hope it speaks to you. It's a very essential concept because health for all is a human right, and everyone is entitled to have to essential health medicine and also to have access to prevention. We're not only talking about treatment here, we're also talking about prevention. How do we make sure that people stay and remain healthy? That is at the core of UHC. Next slide, please. So how does it work? To make sure that UHC is effective, we are looking at 3 different criteria. So first, the population coverage. Who is covered? Who is not covered? We've talked a lot this morning, I noticed, about people with disabilities. For instance, some people with disability are not able to communicate properly because there are not sufficient translation effective or any other material to help them make their voice heard. So how do we make sure that they have access to essential health services? The second point is not only about who is covered, but also what services you can access. It's great to have access to some services, but if it's poor quality, finally, it just harms you even more. So this is very important and very crucial to have access to services of sufficient quality. The last one we talked about is financial protection. Okay, let's imagine you have a treatment that is available for your specific condition. That's great, and it's just nearby to the hospital. Great, but then you go there and you realize that you must add a lot of money, put out a lot of money to get this treatment, and you're just not allowed to have it. So this is very important and very crucial to being able to have a financial protection sufficiently high to be covered. Now that we're done with what is UHC, we're gonna talk more about some really important commitments. So first, before we go to this slide, let's just say that also UHC is one of the priority of very important global institutions, the UN, the WHO, the World Bank. And it's part of the Sustainable Development Goals. Do you know what the Sustainable Development Goals are? I hear some yes, but very shy people saying it. Yes. So the SDGs are goals that have been set up by the UN in 2015 and that are aimed to be achieved by 2030. It's about education, it's about gender equality, it's about climate, and it's also about health. So UHC is a priority at the global stage. And very recently, in September 2023, the UN adopted a resolution. And this resolution it's a 20 pages document. There's many things in there, but what is important is that all the countries from the UN who signed up this resolution committed to make progress on UHC. This is very important because you can use this document to go to your national government and say, hey, what are you doing about this commitment? How are you moving to action? So, and this is very important because as you know, in your everyday life, we are far away from achieving UHC. As you can see on this slide, more than 4.5 billion people, which is over half of the world population, just imagine, do not have access to essential health services. And more than 2 billion suffer financial hardship due to out-of-pocket expenses to get these services when they exist. So we know that the situation is still dire. So what about the region, regionally in Africa?
So we know that progress on UHC is also off track here. We have 615 million individuals, so about half of the continent population, who do not receive the healthcare services they need. And about 97 million people, 97 million, face financial hardship to access the services. Well, we don't have to retain and remind of this number, but it's just to give you an idea of how many people are suffering from financial hardship and do not have access to essential health services. But the good thing is that we are making progress. We're still off track, but we are on the right path. African countries committed to achieve UHC, including in the Abuja Declaration that was adopted a few years ago, to allocate a certain percentage of the budget into health, 15%. And also, we have over 23 African countries who had increased their health spending, which is very important because we have to get resources to being able to cover the most people and to make services available at sufficient quality. Now, to finish on this presentation, we all have an important role in achieving UHC. So, Honorable, you have an important role as parliamentarian, right? As improving the budget for health. And we talked about that during our session yesterday, Honorable Kalila, which was very interesting to know more about the role, but also to make some UHC policies and regulation adopted, right? Even if you're not directly like adopting it, but you have a huge role in voting for them. Then we also have a role as civil society. And as youth, all of you here in the room has a role to make UHC achievable. How? First, by advocate for UHC policy, right? Make sure your voice are heard, make sure your issue are raised, and that the policymakers and decision makers are aware of them and can work on them. This is a very important role we have today. We are off track. We will not achieve UHC by 2030, but again, we are on the right path. So we must keep going, keep advocating at youth, have this important discussion with members of parliament today and the following days and again until we reach out and achieve UHC. Thank you, everyone.
Thank you so much, Laura. Can we clap for her as she walks back to sit? All right. So as we have heard from Laura, there is so much that us as young people have to do in order to achieve the universal health coverage, as well as the parliamentarians that are seated before you. So I'll just share from the last workshop. Actually, someone didn't even remind me. I said it was on Thursday. It was on Wednesday. All right. All right. So on Wednesday, CSEM trains the youth platform, the TYPs, in a workshop that brought together 65 youth advocates from 8 countries representing the region. So now these young people, some of them are in this room. Now the objective for our workshop was to strengthen the advocacy skills of these young people so that they can be able to advocate for universal health coverage, as Laura has shared a bit more. We want to see everybody accessing health services without difficulties or facing any challenges when it comes to financial hardship. So everybody in our country, in the region at large, should be able to go and get health services. So the key outcomes for our workshop were to strengthen understanding of the importance of UHC and skills to engage decision makers. in different countries who are working on universal health coverage. For example, the MP Honorable Kalila is here, who I am very well elated that he has so very much experience even at regional level. Also, we did learn how to plan and also bring on paper call to action. Like for our decision makers, you just don't go to them with whatever idea. So we learned on how to streamline, not to beat about the bush, but go straight to the point and how to position ourselves. We also developed specific asks for them, for our decision makers on specific health issues, which I'll share briefly. Also, we built a community of advocacy for advocates for the UHC in the region. We believe that this is not the end. So we believe that even as people go back to their countries, we'll create a team that will continuously to work on the universal health coverage, with different specific issues that are emanating in our countries. So I would like to just share to you, Honorables, some of the call to action that these young people presented in our meeting. So some of the common issues that came out for us to come up with this paper to present to you today came out from these real young people who have real issues representing real communities. Of course, what is not real right now is my hair. Call to action number one, we together with these young people are calling for government specific people like you, sir, who are also in charge in ensuring that sexual reproductive health related matters from young people are heard, Honorable Kalila, to prioritize marginalized populations. Amongst these young people, we have so many representations that talked about people living in rural areas. Today, the representation of the young people living with disability is not even amounting to the people that are supposed to be here because of the challenges that they are facing. And so our call to action is to ensure that they are also part of the platforms where they can air out views in their specific district. We appreciate so much that before there are high, there's been platforms where in districts, young people are sitting and provincial level and coming to the regional platform. However, there's so much challenges in movement, reading of materials, braille, so that they can get information for platforms like this. You find that the young people who've been coming to these meetings are the same ones because they're the ones that can afford. We want government to begin to question systems on how these young people in the various communities can participate. Of course, we know you have the means through various ministries that can begin to question this. So our call to action today is that a lot of marginalized populations can take part in such meetings. We are also calling for young people not only to be involved in civic participation during elections. Can I hear yeah? We realize that a lot of young people are very excited when it comes to elections, and we are left without a choice because mostly when it comes to elections, a lot of people take it as politics, but we want to be engaged in a process of learning what elections can bring out for our good. Even after the elections, we want to continuously engage with you. And I would like to uphold you today for showing up besides other duties to come. We want to see a continuous engagement. And from this, we are asking for that one action point from you as you respond to some questions from the young people. If you have any opportunities where young people can come and learn concerning elections from where you're coming from, please call it out now and we can have a representation of these able young people to sit on those panels and learn what elections are about, what civic participation is. It is not just about election, it is also speaking into the universal health coverage, because when young people participate in elections, they'll be able to put specific leaders who will push agendas of health for their good. Lara, this is where I call her for her password. Okay. Yes, thank you. The third call to action was also engaging people from different platforms where discussions are ongoing concerning the cultural barriers, such as initiation ceremonies that hinder universal health coverage. We are saying that if there are salient issues that are not addressed, for example, cultural practices that are harmful to young people. For example, one of the common issues that came out even from the other countries is that there are certain laws that are conflicting traditionally as well as policies when it comes to culture and what it is implementing on the ground, but also what policies are saying when it comes to traditions. So chiefs are given their own mandates in running their own chiefdoms, but we are seeing that a lot of perpetrators are coming from the cultural perspective, and they are talking about the fact that it is their culture to practice certain traditions. So now our call to action is to ensure that in as much as discussions are going on with the chiefs, so far there's a lot of strides made with child marriages, but we are seeing again work equal to zero initiation ceremonies such as the Mukanda, where there's harmful practices. And we just heard from UNICEF that from these initiation ceremonies, a lot of girls want to practice these things, and we have escalating numbers of HIV infections. How then can we see these harmonizing? So we are calling that we need to have systems in place where chiefs are held accountable when it comes to the health of young people and these initiation practices. The last one, honorable members, our call to action is to ensure that even as you lift these bans, as you plan for young people's platforms to discuss, we need to have action points from this house, even as the gender division is talking about engaging the chiefs from various districts. We want to see certain young people from this room be part of those platforms. We don't want to hear that there are programs designed on our behalf and then the young people just need to come and attend the meetings. We want to have a place in those meetings. So if there are any meetings today, honorables, we are ready to take up those spaces. You just need to tell us when the meetings are happening. We are not going to ask for transport refunds. We just want to participate and make sure that the agenda is pushed forward. Am I right? Am I right? Now, I'll just, am I right? Am I right? Before I'm not going to talk about the resources for UHC right now, but we'll go directly into our discussion for today. And I will be opening up the floor for people to ask questions. So these are the real-time MPs. You need to ask the questions you are asking in the previous sessions. Hopefully today they'll have some answers for you. May I just also make it clear that we are not interrogating you. We are not putting you on the spot. What we want is to plan with you. If there are plans underway, we want to know how we can get engaged. So I have to, right now, my agenda is to firstly ask honorable member, what are the strides right now, Honorable Kalila, being made on the regional platform as well as local platform in attaining UHC, universal health coverage, for all?
Yeah, so thank you very much, moderator, and I want to begin by welcoming all of those of our young people that have come from various parts of Africa. I welcome you to Zambia, specifically to Lusaka. As you know, Zambia is a land of peace and a land of friendship. I'm sure you have already seen the warm reception that you have received. That is what we are famous for, isn't it? Yeah. So you are welcome, and please feel at home. This is your second home. My name is Honorable Kalila. I am a member of parliament, and also I chair the health committee. I'm very happy that you invited me to come and speak to you. I really enjoy being among young people.
Thank you,
because I was also once young.
Are you going to clap for that?
And I often get amazed by the amount of energy and zeal that you enthuse, that you radiate at all times. And I know that out of this grouping, we are going to get the leaders of tomorrow, right? Today, okay. Yeah, are you threatening our positions? Well, the truth of the matter is, out of this group, we're going to have members of parliament, we're going to have ministers, we're going to have chief executive officers of various companies.
Yeah,
we might even get one or two presidents out of this group,
Yeah.
right? Yeah, so thank you very much. I am here, obviously, to speak on the subject of universal health coverage. This is an idea that has already been explained by Laura here. And I want to ask you that it's not a complicated idea. The word universal simply means everyone, all. That's what it simply means. If you Google it or if you check it, it simply means everyone or all. We are not talking about the universe, in case you can be misled or be confused. So when we use the word universal, we simply mean everyone, all. And then the next word is health. You all know what it is. It simply means a state of well-being, both physical and mental. In other words, just being in good health. The last one is coverage, which Laura illustrated with the umbrella. So when we talk about universal health coverage, we are simply saying that as government or as your leaders, we have a duty to provide essential health services that are of good quality to everyone in our jurisdiction as nations, without leaving anyone behind. We must be inclusive, including those marginalized members of our populations or communities, which the moderator was talking about. And this idea is worldwide, talking about whether it's regional or not. So this idea is recognized worldwide at UN level, where our heads of state do have meetings every September. They all agreed, and they continue to agree. And many of them have signed to the idea that in all their countries, they must provide health services of quality to everyone, without any regard to sex, age, sexual orientation, or other forms of consideration, whether you're an immigrant, you're a refugee. Everyone, as long as you are within the borders of a particular country, the concept universal health coverage entails that all must be covered. And if you see at UN level, we have a political declaration on UHC, which all our countries signed. When you come down, SADC is a member of the UN. So all of us But for us in Zambia, this is what I want to say. We started much earlier than most of our friends in other jurisdictions. We've been reforming our health sector from the days of our founding father, Kenneth Kaunda, specifically up to 1990, when we started what we're calling Health for All. And if you look at our vision, the famous vision or phrase which is always used, that we are committed to providing cost-effective and essential health services as close as possible to the family. This is all UHC, meaning that we want to make sure everyone is covered. So we are happy to do that, and we continue to do that. Whether you have money or not, we have to provide services to you, because we know that illness sometimes happens when you have no money. So in Zambia here, we decided that there are those of our people who are poor. They may not have the money to pay when they break a leg and they go to a hospital. So how do we address this? That is why we started NIMA. NIMA was started precisely to address the question of financial hardship, and our NIMA law is compulsory. All of us as members of NIMA were supposed to register so that we take care of this. So I think that, moderator, for us as members of parliament, it is important that this audience must understand our role. So, you know, we have three arms of government. We have the executive, which is the ministers, the president, the vice president, okay? And then you have the judiciary, which consists of the courts. Then you have the third arm, which is the National Assembly of Parliament, where we are coming from. Our role is to act as a watchdog on the administration of the government. So together with civil society and ourselves, we must always ask those questions which you're asking us in turn to the government. In this particular case, on the issues of universal health coverage, we're supposed to ensure that we speak for you, we represent your views, we take them to the Ministry of Health, especially my committee, to ensure that we ask them all those difficult and hard questions which were being discussed this morning. So basically, we are also your mouthpieces. That's number one, and that's why we are representatives. So even you who are already practicing, I can see when you become members of parliament, you must be advocates on behalf of your people. Secondly, we make laws. So in this particular case, as a country, we have several laws that govern the operations of this state. And in particular, in the health sector, which you're talking about, I have just told you about the National Health Insurance Law, which is popularly known as NIMA. This is a law that was crafted to ensure that we attain universal health coverage by making sure that people are not worried about where they're going to get the money to pay for health services. We make several policies. And in these policies, we tend and we try as much as we can to be inclusive. For example, right now, there's a process going on to review the national health policy. And even when you look at the previous policies, adolescent health is a priority for this country. That's why you have Madam Mabel here, who is coming from the Ministry of Health, in charge specifically talking about adolescent health. And we believe that you cannot provide quality health services if you exclude certain sections of your population or your society. And our young people, as you know, in this country constitute more than 60%. So you are major stakeholders. You are actually the owners of Africa. So basically, we need to listen to you. You need to be part of the conversations. And I'm proud to say that in Zambia, we try as much as possible to ensure that we mainstream the voices of the young people in our discourses. If you look, starting from His Excellency, I think some of you have participated in our National Youth Day activities where he himself is present. The other day I saw some of our young people seated with him and asking him questions. Sibu, is he here? Yeah. Well, whoever, I'm sure you can agree and attest to this. There was also an annual youth Indaba where you participate. There's a whole Ministry of Youth and Sports. This is just to give you a platform. You actually own a ministry responsible for your own affairs. We have the National Youth Development, what is that? The statutory body responsible for youth affairs. Yeah, the National Youth Council responsible for youth affairs. It goes all the way up to political parties. You know, political parties have strong youth wings, eh? You know that, eh? I know most of you are thinking about Julius Malema and others, right? So all political parties have strong youth wings, which provides a platform for the young people to participate in the civic affairs of their countries according to their own ideologies and so on. And it goes all the way. So we think that there are adequate channels and platforms, moderate, for our young people to participate in national governance issues. In fact, in other jurisdictions, it starts from the constitution to ensure that there are specific seats reserved for the young people. Unfortunately, in our jurisdiction in Zambia, we haven't yet amended or reformed our constitution to go that route. But there have been dialogue and discussions around ensuring that we change our constitution to ensure that there are specific seats reserved for young people, reserved for women, reserved for marginalized groups, including disabled and so on and so forth. So we continue this dialogue. It is not for us to make a constitution for you, but it's for you to advocate for this and together, because the constitution is about the aspirations of the people. If that is the aspirations of the young people, who are we to say no? So basically, we believe that when it comes to inclusion, we are on the right path.
Thank you so much.
Lastly, our health services do not discriminate when you seek services, even as we heard. We heard this
I would
morning
like
from
you
the
to
participants.
say that again.
Yeah.
I want honorable member to say what he just said. I know these young people are burning with questions from everything that you have said.
Exactly.
They have fire questions. So please repeat what you just said. I want your ears to be very open.
I say, and I will say it again, that our health services do not discriminate when providing services to our citizens. Whether you are disabled, whether you are female, male, whatever race you are, we do not discriminate because we believe in a human rights approach in delivering our health services. We also believe in a public health approach. So if there's anyone who has ever been discriminated, we'll be keen as your advocates and spokesperson to take up such a case.
Thank you so much, Honorable. So much said and so many nice things said. Before I come to you, Honorable Msanje, I just want to open up the floor. I know that these young people are burning with questions, so I'll take 2 questions. There we go, there we go. There has been a burning question concerning NEMA. If NEMA is free, say yeah. I will not ask on behalf of these young people, honorable member, but there's been such a cry from these young people concerning what the insurance policy is about when it comes to NEMA and how accessible it is. I'll allow a question from Jeremiah and then Ida.
Thank you so much, honorable members of parliament and my colleagues on the panel. We really appreciate the level of knowledge and context you've given to this conversation. Mine is going to be part 1 of the question, and my colleague right here will finish to part 2. Can I get a yeah? Honorable members of parliament, my question is with regards to NEMA. I think my colleagues in the audience, the young people especially, will agree with me that there's a huge challenge when it comes to NEMA. Can I get a yeah? And the challenge is as follows, honorable members of parliament. NEMA, in the accredited pharmacies, I'll speak on pharmacies, we are not being offered these SRHR commodities.
I am speaking from experience. What is happening, honorable members of parliament, if you didn't know, is that when you walk into a health facility or a pharmacy as a young person, if you're going to look, for example, for a morning after pill, if you're on NEMA, immediately you just say, I'm here looking for a morning after pill and I have my NEMA number, the pharmacist will even frown. And they will say they don't have what you are looking for. It is out of stock. But if another young person walks into the same health facility, the same pharmacy, and requests for that, paying cash, they will be given. This is something that we have done before as young people, not once, not twice, and at different pharmacies. My question is as follows to you, honorable members of parliament. What are we doing in terms of enforcing a law that will be strict on these pharmacies who do this, because we are speaking about universal health coverage. And we are also reliably informed that through the Global Fund, NEMA has been given money. Can I get a yeah? And they probably have this money as we are speaking, but these young people in this audience and many others in this beautiful republic are not being given. And we know that majority of the pharmacies in our country are privately owned, but young people are not getting access to SRHR commodities. Honorable members, I would also like to hear your suggestion on how we can immediately work on this. I'll let my colleague ask part 2 of the question.
Thank you so much. Good morning and great panel. Honorable Member of Parliament, my name is Ida Mlala Nonde. I work for Treatment Advocacy and Literacy Campaign. My question goes to you. Honorable Member of Parliament, the purpose of NEMA was to not only provide universal health coverage to everyone, but also to ensure that the health system of Zambia, the Zambian people, is less dependent. It is self-sustaining and able to fund its own health services. But Honorable Member of Parliament, do you know that it is unbelievable and it's also impossible for a normal Zambian person to be sick in Zambia today? Why? Because NEMA will not provide them with the basic health services that they need. I can assure you, Honorable Member of Parliament, when you look at the vulnerable and a vulnerable population such as the elderly, they are entitled to NEMA, especially by age, and most of them have got chronic illnesses. But when they go to seek these services in these health facilities, in the health facility, they will not be able to access simple drugs such as hypertensive drugs that will cause even a 10 quarter. And when they go to the health facility, they will not get it because it is out of stock still. Honorable Member of Parliament, what are you doing through NEMA to ensure that these elderlies who are vulnerable are accessing these services and the funding that NEMA is getting is being used on the people and not those luxurious vehicles and offices that is being used to rent these offices? Thank you.
Okay. So
Thank you so much. There's so much people raising their hands, I'll ask. Honorable member is still here. We have another honorable member here. I'll ask that honorable member Kalila responds to 2, and then we'll go to honorable member Musanje because of time.
okay, so
please go
thank you.
ahead.
Thank you very much, our valued young people, and for those very important questions coming on with regard to the question of NEMA. And I need to explain to you what NEMA is all about and what its objectives are. So, like I have indicated to all of you, that previously we noticed over the years, in fact, there was a time when, remember, we had what we were calling user fees in this country, for those of you who are a little bit older, that you needed to pay wherever you went to any facility around. Okay, but you also know that not everybody is able to pay. So along the way, we saw that there were significant challenges, particularly from our rural folk, the marginalized, the poor, and so we did away with user fees for the rural areas. But by the time we reached around 2012, a decision was taken to actually remove even those user fees that were being charged in the urban areas, particularly for primary health care services. Okay? So today, as I speak, and I'm sure Mabel is listening, our primary health care services are essentially free. If you broke a leg today and we rushed you to Chainda, they will not chase you. They will attend to you. Okay? But we also know that there are other specialized services that you may need. You may need, for instance, to be investigated, including complex investigations like CT scans, MRIs. You may need to undergo complicated surgical procedures, and these things cost a lot of money. And they cannot be given entirely free of cost. Otherwise, the government would go broke. But we had to sit down and say, okay, what do we do? Because people cannot afford these fees. A decision was not taken because of what we are talking about here. In order to make everyone access our health services, we needed to remove this issue of cost. So we have to remove the financial burden from you, our citizens. We should pay for you. Okay? So how do we pay for you? So we created an organization called NEMA in 2018. It's not very far, by the way. 2018 to today is how many years? Basically 4 years, right? But we started maybe in 2019 or 2020. So NEMA is basically a new organization that is meant to pay for you when you fall sick, when you go to a facility. Okay? That is how it was conceived. And how was that done? One, you needed to register to be a member of NEMA, so that when you fall sick, you have a membership number, as you have said, then you submit your claim there, they pay the hospital where you have gone to. But we also needed to exempt some, like the elderly, okay, 65 years, and they don't have to contribute. But you have to register to have a card. Now, this scheme needs money to use to pay these clinics. So where does that money come from? So we ask that those who register must contribute a little. Okay? So when you register for NEMA, if you are 18 years and above, you must contribute a little. If you are less than that, you don't have to. But you can register. The contribution at the moment, in my view, it's affordable. It's 1% for those who work, 1% for you, the employee, and another 1% for your employer. And then for these other groupings, all of us, we're actually supposed to go there and register, and they'll tell you how much you'll be contributing per month, or how much you'll be, if you want, you can pay 1 year in advance. Now, the money you contribute is so little. If, for example, you break your leg and have to put a POP and see the doctor and so on, you find that it's quite significant. But you find that you were contributing very little. The reason is that if many people contribute, if we pool our money together, it will be a lot. And we know that in that month, not everyone will fall sick. So we should be able to have money to pay for those who fall sick in that particular month. So this NEMA is a body that was created to make sure universal health coverage works, but also to pay for your medical expenses when you fall sick. In so doing, and this is now to answer the specific questions.
You hadn't yet answered.
Yes. So I gave a background. So you now understand why NEMA exists. NEMA was not conceived to build hospitals, to build clinics. No. That was not the idea. However, it was hoped that it will be sustainable to such an extent that there will be extra money remaining. That extra money then can be pulled back in improving our services. Do you see? But up until now, that has not happened because the scheme is struggling. Basically, it's struggling in the sense that the money that you are paying, you are contributing, is not enough to do what we want to do. It is a new scheme, and all these concerns that you are bringing forward have been noted, and they will go into an improvement as we hope to reform NEMA. Now, moderator, my young leader there
Yes, sir.
claims that NEMA is refusing, or basically the pharmacies are refusing to honor some of the requests for reproductive health commodities when you go to them. They are refusing because NEMA will not pay them if you do not have a prescription. If you go just there and say, I want a morning after pill and NEMA will pay, what are they going to use to claim your money back? Unless you tell us that I went with a prescription written by a qualified doctor and this pharmacy refused that because you are NEMA. That's number one. Number two.
Honorable member, people are, I'm hearing, I'm hearing.
Number
I think
two.
that this is a very
Yeah,
hot
so we have to explain
issue.
this. We have to explain this NEMA
Please
concept.
hold on. Yes, we are coming to you, to your hands that are raised.
Yeah, the most important thing you must understand also is that NEMA has what they call exclusions.
Let's listen to this. I think this is important.
Yes, NEMA has what they call exclusions. They have listed what they will pay for, and they have also listed what they will not pay for. That's the point which you must know. Why? This is meant to ensure that the scheme is viable and they should pay only for the minimum health care package that takes care of our disease burden and the majority of our citizens. They will not pay for anything just because you want it. It has to follow exactly what they agreed to pay for. So if what you are asking for does not fall into the category of what they require to pay for, they will not pay for that. Even the amounts of money that you pay, they have also ceilings. Beyond a certain amount, again, they will not pay. Of course, to safeguard abuse and to ensure that the scheme is viable. However, it is a very important scheme to which I urge all of you to join. So it's not a question of walking into NEMA and demanding for anything. It must conform to the requirements and guidelines and what is listed. Thank you.
Thank you, Honorable Member. I was hearing some noise because I think this is an issue that we need to table. You and these young people, which we can put on our way forward. We would like to request, Honorable Member, that if there are any clarifications of that matter, from my side, representing these young people, hearing the mamas and the it means they are not aware or up to date to that information. Now, here is the gap we need to identify and pick on from today. How many people are ready to have a side event with Honorable Member so we can exhaust ourselves? If you're not raising your hand, I won't advocate for you. He's here. Now, like I said, Honorable Member, this is what our cry is about. A lot of our young people, when our health workers are giving this information, they are in a hurry to attend to a queue and they cannot write the prescription. It is so hard to get such information. And our cry today is that the systems must be interrogated to give quality information on what we want. If there are exemptions on certain products, on certain services, we want to know. We want to know from their mouths, from your mouth, so that we will not be a pain to you. Yeah. Call to action is from this meeting. We are taking an action point that we will come to your office. Personally, I will do it to ensure that we have a follow-up meeting before the next high. We will know what NEMA is, what are the exemptions, exhausting every information, and what we as young people are bringing to the table to ensure that we get the quality services that we are looking for.
Thank you.
So this is what we are giving.
So I'm quite willing to come even with a colleague from NEMA.
Thank you, guys. Come on. We're making progress here. Thank you so much.
So I think the young people, like most of our citizens, have the idea that simply because they've contributed to NEMA, NEMA will pay for everything. No, it's not the case, unfortunately. But there are attempts to review NEMA. It's only 2 years. And so this feedback like this will go in improving it.
Thank you.
According to your voices, you see. So we can change, add a few more services to the benefit package, as we call it, that you're supposed to benefit. Currently, the benefit package, the package of what you're supposed to benefit is restricted.
Yes, sir.
But we can add as we go according to the feedback.
Thank you so much. I love that. I love that we have an action point to follow up. We are going to look out for that review meeting, guys, to make sure that we are part of it and our voices are heard. I'm going to go. I apologize for all of that because it was so real to them and they just needed to air out their views.
Sure.
Before I go to Tandiwe, so she will need an interpreter. So I just want also Tandiwe to share from what Honorable Member has spoken about, but also her experience in learning about advocacy, what she is currently doing as a young lady living with disability. She has given herself to doing a part in attaining universal health coverage. However, Tandiwe has spoken of so many challenges after learning yesterday from the CSEM workshop on the tools for advocacy. She has her own challenges that she's been facing. One of the things Tandiwe mentioned to us was concerning the access to constituency development fund. In her state, Tandiwe has made her own strides. However, this has been challenging for her to reach out to other young women. And I would like Tandiwe to share with you her experience as well as her challenges that she shared with all of us.
Thank you so much. My name is Tandiwe Banda. I'm from Zambia. I am working with Youth Enabled Zambia. So this is an organization. So it's an organization that champions rights for youth, women, and children with disabilities. So one of our objectives is to ensure young women and girls with disabilities have access to quality health care services and are well informed about their health rights. For example, we have been doing menstrual health campaign awareness to young women, helping them to know their rights to safe menstrual hygiene. Our organization has also been campaigning for accessible information for sexual reproductive health access for young deaf women. So there's a big information gap when it comes to safe practice for deaf girls because of lack of sign language interpreters in healthcare facilities. Many deaf girls have fallen victims of unwanted pregnancies because of a lack of awareness about safe contraceptive to prevent unwanted pregnancies. So the only way to ensure UHC for persons with disability is having all health information in accessible formats and having healthcare providers learn at least Zambian basic sign language. So the health centers also need to be built in a way that is easily accessed, not only by deaf people, but even those with physical disabilities. So we need more resources for us to achieve all these agendas. We need also to have campaigns on national TV to create an impact and also awareness. But it has been hard for us to access the CDF grants. So we have tried so many times to access because of lack of information on how the process of applying for CDF as who are deaf. So those are most of the challenges that we are having. So we have communication barriers and we don't know the processes and it's not being explained to us in our language that we can understand, which is sign language. Thank you so much.
Thank you so much, Tandiwe, for that. And apart from Tandiwe sharing that, we've had so many young people talking about the procedures. Just this morning, on radio, on a breakfast show, I heard Honorable Garin Kombo talking about how they are now decentralizing the funding from central government to be managed by local government and to ensure that the WDCs themselves are handling the monies from the community, ensuring that the young people are applying and the processes of selection is done from the communities. But honorable members, you have heard the challenge that this young lady is presenting forward to you. We would like you to respond, Honorable Musanje, on what we need to do immediately after this conference to ensure that young people are well informed on these processes, especially young people like Tandiwe, who has already shown that she is doing so much from her own little resources. How then do we follow up with a person like Tandiwe and many others represented here? Honorable Msanje.
All right, thank you so much. Is it afternoon? Yeah, so good afternoon, everybody. Ahoy, young people, ahoy. Viva, young people, viva. Yeah, so thank you so much. Basically, with regards to persons with disabilities, which is also the correct term for us to use, and not living with. I guess, I hope in the session you had, you could have dealt with some of those, since they don't live with the disability, but they actually have the disability. So a person with a disability, in line with the UN CRPD, the Convention on the Rights of the Persons with Disabilities, and our ZAPID Act, or Zambia Agents for Persons with Disabilities Act of 2012. So as a country, we are signatory to that convention, we ratified it, and we domesticated it, meaning that we made it into local laws of our country. And we have the Agency for Persons with Disabilities, which is represented in every provincial center. Of course, they are not in the districts, but they are available at every provincial center. And their job is to register persons with disabilities. They run the register of persons with disabilities in the nation. So every person who is born with a disability has to have a disability card. That disability card is what entitles you to a number of benefits, including access to citizen empowerment products as well as CDF products. The ZAPID is also responsible for research. It's responsible for both rehabilitation and habitation for those who need rehab, as well as delivery of specific projects that are delivered by government. And that is the agency that is also responsible as chief advisor to the government through the Ministry of Community Development. The Minister of Community Development, Honorable Doreen Mwamba, receives advice from ZAPID. So when we have issues that we want to deal with in the area of disability, these issues must be taken through the right channels until they are able to reach ZAPID, either in your province or at national level here, where we've got Dr. Musokwa, who is the DG for this agency, and many other agencies that are working in this area. When it has come to Constituency Development Fund, the Constituency Development Fund access for persons with disabilities and maybe all the youths depends a lot on information sharing, because the process is dealt with at the zonal level. Every constituency has got what is called wards. And these wards, where you come from, they have got councillors and they have got the ward zonal representative. And those zonal representatives, when they meet, they elect the ward chairman who is in charge of that WDC processes there. Therefore, prioritization of services is done from the ward level. And it is from there where you submit your applications for youth empowerment fund and women empowerment fund. This empowerment fund is in two categories. There is a loan which gives you up to 200,000 kwacha, which is up to maximum 4 years repayment at a very low interest rate of 5%. And there is a grant which you receive up to 40,000 kwacha and we don't need to pay back as long as you are a group But over the years, and the like, and those who have got the ambition, because they put effort to it. If you've got ambition, you put effort to it and you find that you succeed. And we must also look at the community projects. The community projects under CDF are a lot. They're supposed to have youth-friendly corners, youth sports centers, and all these other things. Nobody applies for those things. The only thing we see in every application for communities where the zones meet and they demand for something, they want a classroom, they want an additional a clinic or a classroom, especially classrooms. That's the commonest what we see. But these other related things like youth annex or sports facilities, recreation centers for the youths and the like, there is no application you see. And that's the challenge, that the horizon of projects to be done is huge, yet the applications are only about classrooms. So those organizations that are working here, we challenge you to look at the CDF guidelines and also sensitize your communities so that they can apply for these other things that are also available, especially in as far as the access to SRH for the youth.
Thank you so much, Honorable Member. I'd like to be part of that meeting so we can escalate this. Thank you so much. And finally, just as we close, I know it's been long and people are angry at me because there are so many questions. We'd like to hear from Zimbabwe. We have a young person that's been doing a lot of work with other young people there, and some strides made in pushing forward universal health coverage. Would you like to share your experiences from what your takeaway was yesterday on Wednesday from the UHC workshop and what you're taking away to Zimbabwe?
All right. Hi, guys. I'm starting on a high pitch because I know the energies are going down. Can you just shake your neighbor to probably listen? Just shake a little more. Yeah, not too much. Hey, I'm seeing others. It's now personal vendettas. All right. Thank you so much. Thank you. My name is Eliad, or Eliad Kupfuma, helper, being my second name. I help people for a living. I'm a young person who's been involved in the development area. I'm a development studies student and I'm a development practitioner, a certified one. And I've been working towards achievement of universal health coverage in different ways. First and foremost, it's something that I also mentioned even yesterday in our conversations, side event on mental health. When we say there's young people, we need to have evidence-based conversations. We don't need to be just talking things, hearsays, or maybe you hear a certain idea here, you just carry it through without looking into it, without researching, without fact-finding, all that kind of stuff. So I employ young people to be knowledgeable of what they are doing. I've been involved in the SRHR as a SRHR defender, sexual reproductive health rights defender in Zimbabwe, and also an award-winning TB champion. I've had researches that were accepted and presented at ICASA, International Conference on HIV and AIDS. Last year around this time as well, around November, I was here in Zambia where there was an international conference on public health, Sci-Fi 2023. And hopefully I'll be also participating in Morocco if everything goes well. And these are some of the positions and some of the opportunities that we get as young people to research, to understand community practices. But all that work in terms of advocacy, I'm trying to join everything that we learned and the stuff that we did yesterday. And I'm realizing something. Unfortunately, I'm a young person, but I always speak in alternative thinking that do not agree with a lot of young people. But I don't intend to agree with you. I intend to be factual, and I intend for us to develop at the end of the day. Young people, we have a tendency of crying foul. Policymakers are not hearing us. They do not come when you invite them, which is true. They can't just come whenever you want them. But here I'm with Honorable next to me. I think my first meeting with him was in Malawi when we attended the SASIC Students and Youth Conference on Sexual Reproductive Health Rights. And from there, he was also in Botswana 3 weeks ago, and I was supposed to join him, but I couldn't join him. But we have a couple of number of students who were also part of that Botswana conversation. And these are conversations we are taking at regional level, where we are experiencing all these challenges that we're experiencing, but we don't really need to be crybabies about it. I don't know if we're together, right? We can't be just having hearsay issues to say, well, this scheme is not working, or I have one case where things did not work quite well. Let's bring facts to the ground. Let's research, do a personal research, validate it, involve your structures. I don't know how structures are like here in Zambia, but in Zimbabwe, structures work from ward level, then we go to constituency, then we go to province, and then national. And along that same process, there are districts in between, but then, well, we don't really use districts that much. But challenges that we are facing, are they in the communities? Are they in the universities? Are they in the schools that we are at? Right? I did a research which was to identify the knowledge gap within TB programming in universities. And this is where I realize there's a lot of issues that we probably need to look at as young people if you're to talk of universal health coverage. Issues to deal with, in as much as we want to end TB, I'm just giving as an example. In as much as we want to end TB, we need to look at the setup in universities. University students can stay in one room and there will be like 7, 6 people, 8 people. And you want to change, or you want to reduce the numbers of TBs, but now you also have to challenge the accommodation policies of a university. You now have to change a lot of things, health policy at that specific university, because you're starting small, you're starting from a community where you probably have control over, or influence over, or access over. So the work that I've been doing, and also with my team, with the support of different organizations in Zimbabwe, the likes of SAWAD, the likes of Youth Advocates Zimbabwe, has been to actually go in the communities, real issues, and then we come and discuss about them. I hear the issue about the NEMA. It was quite interesting. And in as much as I don't have much information on how it's gone, I want to employ young people to say, don't just look at the NEMA as an individual thing that you probably need change in. If it's NEMA, that means it's being funded by the government. If it's being funded by the government, you probably look into the public finance management. How is it coming out? What are the time of return? Do you need to change things from that level so that when the money is out, there's accountability, there are processes that you understand how things are going to be. Where is NEMA going to be funded from? How do we as citizens contribute to that? Are you getting it? So the issue is really about health, but then you don't just need to look things in the individual aspects. You need to probably look at the whole spectrum of it. And effective advocacy from the pre-event session that we did. We noticed that if you want to change something, if you want to advocate something, number one, you need to identify the real problems, of which we all know the real problems. That's the honest truth. But maybe we just know them at a surface level. We are not really down to what exactly is happening. So that's number one. Number two, identify people, agents of change. We're talking of religious leaders, we're talking of lecturers. Most of us here are students in universities. You do dissertation, chapter 1 proposal, chapter 2 literature review, chapter 3 and all that. And then after getting your grades, you throw away the dissertation. But why can we not employ even the educational capacities that we have, that research that we are doing in high school, in universities, to be practical example, to say, hi, counselor, I did this research when I was doing my dissertation and my thesis, and I feel like this can be petitioned in the parliament, right? We have parliamentarians that are there. In Zimbabwe, section 145 of the constitution allows an individual to petition the parliament. And you can petition the parliament either in written, or you can even attend the parliamentary sessions where that particular topic is being debated upon. You won't have a say, but you're allowed to attend and even give feedback. And these are some of the ways that probably as young people, we need to look into the law-making processes in Zambia, the amendment processes. How is a law amended? most of the times we just say we want to amend the age of consent and all this, but you don't realize that we need to do an agenda setting. We need to do ABCD. Who do we need to see? What kind of friendship do we need? What kind of information do we need? What kind of other organizations and likely-minded people are working on the same idea? Because if we work in silos, I'm a young person, I'm working from Western Province, and this one is working from this one. But if we are to find ourselves and probably push an agenda as a movement building, I'm sure we'll be able to access
Thank you
universal
so
health
much,
coverage.
Elliot. That was a lot of passionate talk. Just a good way of rounding up our meeting. I guess that this is one of the things that the executive director has been talking about to ensure that we continuously learn from different countries and what are the strides, some of the common things that we are already doing. And that is why we have rebranded to TYP, ensuring that we are learning at regional level. So such insightful learnings will be shared on those platforms. At this juncture, I would like to say thank you to my panelists for availing their time. We cannot say thank you enough to you, but just saying to you that whatever conversations we have kicked up and brought forward, we are hoping that we'll continuously to engage with you. And also we have taken away the key action points and we'll be following up as you walk out of the building. Rahai, can we please do the Parliament Kilo for the honorables and the people in front, please, as we are upstanding? Who knows Parliament Kilo to come and lead? Come. Run. Everybody, please be upstanding as we clap for our panel.
Thank you so much. Okay, it goes like this. You clap 3 times, then I'll shout parliamentary kilo. Yeah. All right, together. Let's go. Parliamentary kilo. Yeah. Parliamentary kilo. Yeah. Thank you.
I'll just give Lara a few minutes. I know people are asking how can they be part of the advocacy teams for UHC? What are the opportunities? What are we looking for? How can you participate? Lara.
Thank you, Veronique. I promise I will be super quick because we all want to go and have lunch. We're all hungry. So thank you everyone for staying here. So how can we follow up on this conversation? We don't want it to stop here, right? Am I right? Good. So the best way to stay in touch and keep advocating for UHC is also to join CSEM. So there is a QR code at the end of this presentation that you can scan. You can also come and see me. If you cannot scan it, I will send you the code to subscribe to CSEM. It's the next slide here. To subscribe to CSEM and you will stay informed. The other point I wanted to mention is that I know there is some people from the workshop Wednesday who couldn't speak today because it was too tight. So I'm waiting for you next to this room when there is a camera after lunch and this afternoon. If you want to record a 1-minute video on your main takeaway from the session and how do you feel at the session, that would be super great. Don't say to bring your CSEM t-shirt, by the way, if you have them. And last point before going to have a break. So to follow up on this conversation, every year there is a UHC Day. UHC Day is happening on the 12th of December, and it's to raise awareness on UHC and advocate strongly for UHC. So we know that our dear honorable member of parliament are already engaged and they are doing events during this day, and we want youth advocates to also have a platform to raise their voices. So please stay in touch, get information on UHC Day. We will follow some information via email if you subscribe to our membership, and we all stay in touch to keep advocating for UHC. Thank you, everyone, and have a good break.
Thank you so much, Laura. That was fantastic.
I think we have a little bit of energy left before we go into lunch. I want us to invite the next presenter, who we kindly beg to take just about 10 minutes into their presentation, so that then we can have a very quick Q&A into that presentation, and then we can go for lunch. So the person holding in between our lunch is this presentation. And can we please put our hands together to welcome Abel Musumali, who's giving us a presentation around climate change and health intersectionality. Welcome to the stage. Abel to the stage. Abel to the stage. As he walked to the stage. As he walked to the stage. Thank you so much. Welcome, sir.
Thank you so much. Okay, so my presentation will be very short. Energy levels have gone down for almost everybody. So my name is Ebo Msumali. I'm a climate change expert. I work for people in need as a climate change advisor for Southern Africa. And I'm also member of the African Group of Negotiators to the UNFCCC on matters relating to climate change, where we do provide technical advice to the Committee of Ministers and the Heads of State as they go to negotiate at these Conference of Parties. So I'll be very brief, because of time. So basically, I will not necessarily make a PowerPoint presentation, but I'll speak from few notes that I've written down just to bring you to speed on matters relating to climate change and health. So yesterday, there was a session on climate change. I missed that session, but obviously, we'll be able to build from yesterday's session on matters relating to climate change and global health sustainability. So basically, climate change is one of the biggest threats the world is facing right now. And climate change poses a lot of threats on water resource, forestry resource, on livelihood, agricultural productivity, and so forth. And climate change has caused, quite a number of other cascading problems, such as migration, where people are migrating from one place to the other, not because there is civil war, but because there is water scarcity, maybe land degradation, and we call these people migrating as environmental or climate change refugees. So in this context, health-related issues at the UNFCCC level, they were actually included into the mainstream of the process during COP26,
Now, the suspect say her man, they shop up on outside. The man.
Where's my Johnny? Johnny, do you know Johnny? Question. If I know see my Johnny, Johnny shut up. Looking for my Johnny, looking for my honey. Telling me this, telling me that, and say this is not for me. Johnny do it for me, Johnny do it for me. With me this, with me that, but I know them for me. We go Canada, we go Tokyo. If they say, if they move, we done this. If they got me, na feel okay. This one na go be.
We are going to be starting shortly, so if you're standing outside, please make your way to the conference room. We are going to be starting shortly, so if you are outside, please make your way to the conference room. There are colleagues that promised us a poem. Colleagues that promised us a poem, please get ready. You'll be doing the poem shortly. Ushers, please direct people to come inside. If you're standing inside, please come inside. The colleagues who are supposed to do the poem, please get ready and come to the front. The people to do the poem, please come to the front. Now wait a minute. You're standing outside, please come inside. The colleagues who are supposed to give the poem, please come to the front. We are going to be going into a panel discussion about meaningful youth engagement. So stay tuned to that. Colleagues for the poem, I can't see you in the front. Emotionally, psychologically, if you're standing outside, please come inside. We are waiting for you. I know the things we did. Mr. DJ, please start the music. Please come inside if you're standing outside. We need to resume our program. Do you need the mic?
We are going to find these two chairs, these two rows. Shall we find them? Shall we find them? Let's give our colleagues an opportunity so that they can also share with us the poem they were getting ready to do. And then we can begin our afternoon session. And maybe your punishment will be to come up there and do what you are doing right now. Hey! All right, you're welcome, colleagues.
Hi, good afternoon, guys. I would like to welcome you to the second session of the therapy. So we are going to start from where we ended. So we're going to start with you, Mavis. Mavis, go first.
He laughs so well. I mean, he laughs the way he throws punches, kicks so well, screams with tear gas on his breath. My God, he even yells so well. Showed me heaven only to drag me to hell. For every bruise, a silent scream echoes through nights. A broken dream where love's embrace stays cold as stone, and innocence is overthrown. Emotions roll, a heart once low, now bruised and sore. Blood fills my face from the touch of his fist. Once a loving prince, now a beast, beating the beauty out of me. This can't be the same guy who I'm fighting. Silence is the only language I'm allowed to use. Please, stop. I'm not a punching bag. I'm human. I hurt, I bruise, and I bleed.
See, we don't know how it feels to be never in that just because we can't fit your standard. We don't know how it feels to feel less than you are, less than human, less than everyone. Even now, I feel less than human. The marijuana smoke is clouding my mind. I can't think straight, see straight. Oh my God, I'm so stressed. The chain smoke in my lungs makes it hard for me to breathe. Hold on my throat makes it hard for me to live. My soul's gripped in the haunting stress. I can't see straight. Oh my God, rescue me from this addiction. The hamster wheel of me pulling back to me where I can go. I need help. Rescue me. I need help. I need to stop.
How do I tell the world that I've been raped? When each word sounds alien to my lips, that I learned how to scream before I could say my ABC. I still can't get it out of my head. Heavy breaths renouncing my innocence. As the HIV virus slowly creeps into my bloodstream, his heavy hands imprinted on my thighs, with my voice being choked as the echoes grow faint. Dekelakoi seems to be the only words I could speak. I thought they said time heals all wounds, but the prints left imprinted by this specter doesn't seem to easily wash off. You see, this flower was torn apart even before it could sprout. Maybe, just maybe, ending this could be the only way to get out of the pain.
I won't pretend to know what you're going through because I don't. But one thing I know is that you are brave. So now to stand the aftermath of a relationship with a maniac. Find the strength that you embrace in the quietness of your heart space. But remember, you don't have to do this alone. The hospital, HYPs, and the police are only a call away. And no, you are not redundant, and you don't have to fit in anyone's standard but your own. You just have to find your place. And with that being said, I would like to introduce you to the youth-friendly space. Thank you for telling your truth, for letting it safely unfold in a safe place where stories are told. Now, first thing first, seek the light of the healthy provider's grace for PEP, a casual English, testing for HIV, and first fight to move to knowing where you stand. It's a journey of truth, not a path of fear. And in that moment, you should remember to talk to your provider for family planning, for it is your tool to your choice and light. Thank you for telling your truth, for I have found hope in your bravery, strength in your courage. You have heard their cries. Now, what are you going to do about it?
If we choose to trust in God, before suspicion, discrimination, we are sure. And ensure that everyone feels free from sex. Because nothing is not. We need to fight also. We need to be active. Giving yourself
Another round of applause for the colleagues. That was beautiful. Thank you so much. So we have a panel discussion coming up next. And this panel discussion is about meaningful youth engagement. Please, it is about that time again where you take out your notebooks, your papers, and your pens and follow closely the conversation. I will invite Malungo, who is going to be our moderator for this session, to call her panel so that the panel discussion can begin. Again, please take out your notebooks and your pens and take note, and please let us avoid movements. I wanted to note one key thing. The table right there is the lost and found table. So if you've lost anything, you go check on that table. If you found something, please go to that table as well and locate what you have found. So if we picked up anything, keys, a power pack, a phone, whatever it may be, please go to that table. Rahai, did we eat? Rahai. Rahai. Thank you so much. Malungo, the floor is all yours.
Should I also start with Rahai? Energy. I don't need the energy that you were giving him. Rahai. Yeah, now I can tell that you people are coming from lunch. How are you feeling? I hope people are not dozing because I know how lunch could get.
All right. So right now we are going to move on to the panel of discussion where we're talking about meaningful youth engagement. We are youths. This was brought here for the youth, so we have to know how exactly these youths are being engaged by different organizations. So we are going to be talking about the inclusion and equitability, the involvement of youth in these programs, as I told you. So joining us today on our panel, we have SAT, we have a representative from SAT. We also have the Zambezi Regional Youth Forum Chair and the National Youth Council of Namibia. We also have Copa Rose in the building. I hope all these panelists are right here. Please, you can make your way to the front. Copa Rose, I haven't seen Copa Rose coming. Okay, there she is. We also have Yak. Could we please have Yak right to the front? My panelists, you've overeaten. All right, so we also have a representative from Zimbabwe. This one is an award-winning mental wellness coach. Zimbabwe, I saw this coming. You people. I definitely saw this coming from Zimbabwe, and I like the energy. I don't know why the others are not giving us that energy. Namibia, you have your person here. Where are the Namibians? Is it that you're a few or you are just not loud enough? All right, thank you so much for being here, guys. We really appreciate the time that you've created to be part of this panel. And the whole purpose of this panel is to engage the youth. We're engaging both youth organizations and the youth in this whole discussion. So without wasting much of your time, we're going to start with that. I have a feeling you saw that coming, didn't you? Okay. For your own information, I don't like mentioning people's names, introducing people, because I'm not good with pronunciations. So I'll let our panelists do that for themselves. So Sat, you could please introduce yourselves for the people out there.
Good afternoon, everyone. Good afternoon, everyone. Can you please make some noise for me? I'm a young person. Okay, thank you. My name is Z. I'm coming from SAT. I love to call myself as a graduate and a student of SAT. I'm one of the young people that started the Youth Hub. As many of you know, to say that SAT is one known of the Youth Hub that we have. And I'm an advocate of sexual reproductive health and rights. I'm an actress, and the other things will follow up. Just to talk about SAT, so we're an organization working in the Eastern and Southern Africa. So we've been in Zambia for over 30 years now. And we mostly do our programming on issues to do with around issues to do with sexual reproductive health and rights. So some of our focus areas are increasing access to sexual reproductive health and rights. So on increasing access to sexual and reproductive and health and rights, we usually work with partners such as Mary Stops. We work with partners such as Africa Directions that can offer young people with HIV. Mary Stops is obvious, that can offer contraceptions and these other things. Then we're also working in removing barriers to services. So this is where the main debate is on the age of access to sexual reproductive health and rights and the age of consent. Then we're also working on meaningful youth participation. As the saying goes, there's nothing for us without us. So mostly in our programming, we always involve young people. I think that's a snap bit about SAT. If you want to know more about us, we have a stand. You can just ask the young people that are wearing the SAT t-shirts, and they'll be able to avail a lot of information to you.
Okay, that was so impressive from Sat. The youths, I'm hearing too much murmuring in the background. Do you know that I like giving hampers? I like giving gifts to those people who actually listen. And when you listen, I ask you about Sat, you can't tell me. That's how it's going to pass. So could we all just try to minimize, because the show is live, so we are getting some feedback from you guys. So would really appreciate. So Sat, I am still with you. Thank you so much for introducing yourself in this. And looking at the fact that we're looking at you.
Or regional level, we have young people that represent us. So So those board meetings, those big ones where people wear jackets, then we just see like big people in other organizations. As such, we can brag to say that we have a young person that sits there and can make a decision to say, no, I feel this is what is right for the young people, and this is the message that the young people are carrying. Yes.
Okay, so is it safe for me to ask if we have any young people from SAT here?
Yes, we have a lot of young people from SAT.
Where are you? Where are
Some
the young people from SAT? Oh,
young
okay,
people
okay,
from
okay.
SAT.
I like working with proof.
Yes,
I
so
like
we
working
have,
with proof.
we have young people from Zimbabwe,
Oh,
from
amazing.
SAT, but we're not the ones that have brought them here. Let me not say that. Disclaimer. But we have young people from different countries that participate in SAT programming. And we are one of the few organizations that allow young people to be versatile in any organization they want. Myself, I'm involved in about 9 organizations.
Oh, nice.
Dedicated to SAT. But SAT makes sure to say that, okay, when we build capacity of this young person, we know that they have potential to even participate on different issues, but with other organizations.
Oh, okay. And I think we have so many young people here who are interested in everything that you have told us. You know the woman to catch. I will lead you, okay? Okay, so I love to be fair. We came from a lady, now we move to a man. So we're going to have our National Youth Council of Namibia to introduce himself.
All right, thank you so much.
Namibians, where are you? All right, okay.
Thank you so much. In Namibia, we have a slogan when it comes to young people like this. When I say one condom, you say one round.
One what? Could you repeat?
One condom, one round, one round. Yeah, that is our slogan in Namibia.
I really hope you people are putting that to mind. You're just not screaming for the sake of screaming.
All right, thank you so much. I am Michael Kachitomwa. You can call me MK in short. I'll introduce myself in 2 positions that I've been the chairperson for the Zambezi Regional Youth Forum for close for 15 years now. And I was the Swabo Party Youth League secretary for that certain region from 2017 to 2022. So I was holding 2 portfolios in the same region, the party level and the government level at the same time. So I have an opportunity to enjoy young people both angles in the government and in the party. So the young people that I came with, I brought them from the party. I
These are
brought
the
them
ones that are
from the
screaming for
structure.
us, right?
It's those ones.
Okay.
Yeah, so that is Michael for you.
Okay, that's good to know. So as I don't know where I'm going to dwell in, if I'm going to start with you being the chairperson or I'm going to go to you being the Youth Council of Namibia, but I think I'll just mix them, yeah? So I know you have been working for a couple of years, you mentioned that. So for the reflecting your past years that you've been working, what have been the most significant achievements of the Zambezi Regional Youth Forum and the National Youth Council of Namibia when it comes to engaging youth in the works that you do?
All right, thank you so much. National Youth Council, it's the umbrella body of young people in Namibia.
Oh, that's nice.
It's an act of parliament of 2009, which has been the custodian of the young people across the country. So Zambezi Youth Forum is a branch of National Youth Council. The one you call province here.
Okay.
In Namibia, we call them regions. So we have 14 regions where we have 14 regional chairpersons. And the
And how
14
many of those are young people?
all of them.
Wow, okay.
Yeah, all of them, the 14 chairpersons sits annually. We have what we call representative council, which sits annually once in a year to liberate the issues of the young people and interrogate the budget of its council. So Zambezi we call it a forum because the forum consists of affiliate organization. For you to be affiliated in a forum, you must be in the 7 regions. So we have affiliates like parties, the whole parties in the country. If they exist in the 7 regions, they are affiliates into your forum. So far, we have a young organization or youth organization that can form clubs, soccer, church members, and those are the affiliates. I'm just talking in behalf of Zambezi region. We have Apostolic Youth, we have Seventh-day Adventist Youth, we have so many clubs that are affiliates to us. Yeah, coming to your question, the achievement that we have achieved so far, as I've been the chairperson for that region, we have projects that are running into the region as we speak. We have engaged so many organizations to help the young people in the region to make projects. The National Youth Council has funding that is given to young people that are unemployed, those who never further their studies. And that fund has been there since I was a chairperson, and most of the youth have benefited from that funding. I think there's achievement so far. As we speak right now, as we go back, I have one of my chairperson who is among us from one constituency who's gonna testify. We have arranged a tournament. In my region, we have 8 constituents. Those one you call wards here.
Yeah.
So we have arranged that we have a tournament so that they can play against each other. We have soccer and netball. So as we speak now, some of the people that are not here, they are busy arranging for that tournament. So that when we leave here, we are going straight for that tournament. The aim of that tournament is to make sure that the young people in the region should know what is National Youth Council of Namibia.
Okay.
What are the importance of having National Youth Council, and what will National Youth Council offer them?
Okay, so still on you, I'm really impressed, firstly, with what you do and what you've been able to do for the youths that are in Namibia. It's so amazing. And so I'll bring it back to what the Rahai is doing right now. As you can see, the Rahai has really engaged different youths from different countries, because we are starting to know how important what we do is as Zambia. So we are bringing different countries together so that we can be able to reach a certain goal. So looking at how you people do your wonderful work, I think it would be amazing to include other youth from other countries as well. I don't know if you're already doing that. Are you doing that right now, or maybe you have plans in which you can incorporate other youth from other countries in your programs?
Thank you so much. I think the interest it's always in Zambia. In 2009, we had engagement or a collaboration between Zambian youth of Livingstone, where we used to come exchange visit to see what the young people are doing in Zambia. And last year, I brought a team here, same in Livingston, to come and know how are they dealing with the issue of unemployment and business opportunities, and how are they surviving. So the team, the reason why we are here today is because of that visit that we made last year to Livingston. So we are not going to stop. We're supposed to go to Botswana this year, but there was misinformation. Otherwise, I could report to you that I was already in Botswana. So, but from here, since maybe Botswana is here, is Botswana here?
Botswana, anyone from Botswana? I heard a very low woo. Where did it come from?
There's no Botswana. So we have engagement also to push the same activities, a collaboration with Botswana. We also want to push to the majority of Zimbabweans that are here. I was in Bruayo 2 years ago, just to go and find out how can we go and see what Zimbabweans are doing in terms of projects of farming, horticulture, and other things. So those are the programs that we are putting in place.
Okay. I feel like unemployment has really hammered us as Africans in almost all the countries, I may say. We have different countries here, and I know you all agree with me that unemployment has been a challenge for most of us in our countries. You have a lot of people graduating from schools, a lot of people who have very great skills, but haven't been to school, and they are all just seated because they don't have employment. So it's so amazing to hear that there are certain organizations like yours that help youth with employment in that way. We really appreciate them for that. Yak. Hi. Okay. So YAC is Youth Advisory Council, and I can see right now we're having a very energetic youth. So I'm pretty sure this is a group of many energetic youth, as I can say. So can you just introduce yourself and tell us a little bit about what you do as YAC?
Okay, good afternoon, everyone. My name is Idam Lala Nonde. I work for a non-governmental organization called Treatment Advocacy and Literacy Campaign. I'm the HIV Prevention and Research Programs Assistant there. And I'm also a mentor under the Ascend Youth Mentorship Program in Zambia. I'm part of the Youth Advisory Council, which is called YAC. So the Youth Advisory Council is a council that was created by PEPFAR through the youth. So as we all know, we've heard of what we call the Country Operation Plan, COP. And last year we had what we call the 2023 COP. And from this, adolescents and young people that were representatives, some from TYP, others from other civil society organizations, sat down and came up with priorities of what they think young people actually need in terms of HIV prevention and also HIV treatment. They went to South Africa and had a conversation, or more like an engagement with Ambassador Nkengasong, and this is one of the people from PEPFAR. And they told him to say, we want youths to be better engaged and not just be brought on board in terms of implementing of ideas, but we want young people to be able to create and design ideas and interventions related to their health, because we believe that young people are the experts of their own realities. So Ambassador Nkengasong actually agreed, and other members that were there agreed and challenged the youth to come up with a platform that they could use to be better engaged. And so they came up with the Global Youth Council under PEPFAR, and now the Zambian youths came up with what we're calling the Youth Advisory Council. So the main objective of the Youth Advisory Council under PEPFAR Zambia is to ensure that youths are better engaged, but also young people are also involved in the creation and also design and implementation of interventions that are related to their own health and their lives. And we have quite a large membership from Zambia. I'm one of the members of the Youth Advisory Council. We're currently developing our TORs, coming up with a strategy and activities that we'll use to implement in the country, and we'll come up with a term for each member. So we have members, general members of the YAC, and we also have members of the executive, and these are the representatives. And However, we're still going to have a place where the majority of Zambian youths will be able to interact with the YAC and engage in some of the activities that they will be coming up with. And one of the reasons for this initiative is because PEPFAR, as we know, PEPFAR has been in existence in our country, I think, since 2003, and they're a major contributor to our health programming in Zambia, specifically for HIV. And we've seen tremendous progress in terms of HIV programming in Zambia. And they've reserved an amount of money, which I'm not so sure of anymore. And one of the people who benefit from that money are going to be Zambian youths. So what will happen is, as the YAC will teach you or will guide you through on how you can apply for that money, you come up with creative and innovative ideas, and you apply for this money, you'll be given this money, and you will implement. And then we'll be monitoring to see that, are you doing a good job? Did we do a good job with selecting you? So there are so many things that I can talk about in terms of the YAC, but for now, I think that's where I'll end. Thank you.
Okay. So I've heard so much about Zambian youth. I do understand that YAC is an upcoming organization, if I may say, that's coming from the Zambian youth. But do you have any plans of extending that in order for us to engage even more youths? Because as we are working here, we are working as one region, we're working as one Africa. So do you guys have any plans of extending YAC to other countries as well?
Okay, so YAC is not an organization. It's a youth advisory council.
Oh, okay.
Yes, so we have got the global YAC, which is at global level where different countries are part of. Then we've been tasked to develop different councils in different countries. Currently, we have 5 member organizations, and these are the member organizations who are going to benefit from the funds that will be coming into this YAC. And in terms of I'll speak on behalf of Zambia. So we currently have a membership right now, but that membership will not forever be the membership of the YAC. They will serve their term. If they are going to be re-elected once only, but if they're not re-elected, they will no longer be the actual members of the YAC. Other youths will be given a chance to actually apply. We'll put out a call for application to be part of the Zambian YAC. And then when you go through with that application, you get to be a member of the YAC. The intention is to ensure that every Zambian youth is given a chance to be part of the YAC. We should not have a prolonged existing YAC member, where someone just sits and says, I'm part of the YAC, but they're not doing anything. We want young people to interchange and have an experience of being part of this advisory council.
Okay, that's amazing. That's amazing. So we have an issue of tokenism in most of these movements, in most of these platforms, in most of these organizations. So how does YAC address this issue, ensuring that young people are not just included in appearances? Let's say, I'm sure most young people here can agree with me. You people have been invited to certain platforms to go there and appear, take pictures, leave, but you're actually not involved, or actually you're not really involved in what they do. So how exactly does YAC address that issue so that people can not only come there for appearances and pictures when you people decide to develop workshops for them, but rather really involve them in what you are doing?
Thank you for that question. So the beauty about the YAC is most of the youths that are part of this advisory council are from different organizations where they are working. So this is solo volunteer work under PEPFAR. And so when it comes to tokenism, yes, I think as young people have been victims of tokenism for a very long time. But I think I would say sometimes we tolerate and let this tokenism go too far ourselves as well, where they'll only call you when they want you, maybe they want to write a proposal for youths. So they'll call you to go and represent them. Then you'll be there seated like I'm on a panel right now. Then when it's done and it's time to implement, they're not going to call you. But I believe each and every one of us are responsible for ourselves. I'm going to give a practical example of myself. I've been a volunteer for different organizations for a while now. But in all the times that I've been volunteering, I have made use of my creativity, and also my smartness. I don't allow just anyone to tap into my ideas when I know they'll just use them for their own personal gains. I've been so creative and intentional about myself and ensure that I'm capacity built. I'm always making use of international opportunities. I'm always making use of different trainings. I've been part of trainings from Malawi where I just apply online, Namibia, Zimbabwe. I've been to so many places, and it's because I find these opportunities online and then I apply. So one of the things as the YAC will be doing is we'll actually be orienting you on how can you apply for some of these things so that if you are into media, how can you apply for a media fellowship? You know, where we find, and then we use the YAC to write you a recommendation letter and you get that fellowship. If you want to go and do some research paper, how can we teach you? How can we connect you to a mentor who will be able to spare even an hour for you on each day and help you as well? But also we're trying to help young people to be intentional about themselves as they are. I believe all of us in here are creative. We have so many ideas. There are so many fellowships. There are so many training opportunities. There are so many conferences. But the thing is, sometimes you don't see it. So maybe you don't have the phone to see that there was actually this call for application. So how do we ensure that you're always up to date, you're always applying, and you're always trying out? And it's good that most of the members of the YAC are beneficiaries of those. And these are, and we're also being the ones who are creating the strategy. Trust me, if it was just ordinary people, they were just going to sit and just say, so, but for us who are like, you know what, aside from just being an advisory council, what other thing can we do for young people? What can we train them in? How can we train them in public speaking, in reading, writing abstracts? How can we train them in coming up with some sort of interventions and also using the resources that they have themselves to expand themselves? I am a beneficiary of both local and international opportunities, and I've taken it upon myself with my other team members to mentor other young people. And it's one of them is the Rahai, where we have most of our mentees here, and that's some of the things that we'll be doing using the YAC so that we reduce tokenism among young people. Young people shouldn't just be used to come and pose for pictures, but they should be used for their creativity, but also that creativity should benefit and improve their lives. That's it. Thank you.
I like the fact that this is coming with some advice. Young people, there are a lot of you who don't know what exactly you have to do to build yourself. Okay? We love to be spoon-fed. I hope that narrative is changing. I have noticed that a lot of young people from Africa, a lot of young people, I don't know about across Africa, outside Africa, but here in Africa, you love to be spoon-fed. You'll be given an opportunity to be in a certain environment, but you don't want to use that. You just want to go there and listen to what they are telling you. Use that forum to actually build yourself. Use that forum to show those people that they have a reason as to why they brought you there. You know, that's the reason why we keep complaining about tokenism. We are complaining about tokenism. But what are you doing yourself as a youth when you're found in these spaces? What are you doing as a youth when you're found at the Rahai? What have you done for yourself? So let's start to use our talents. Let's start to use our minds, our creative minds. Because bear with me, we are very creative. We are more creative than our fathers who are not the youths. Sorry, we love you, but we are very creative. So let's start to use that so that we can be able to fight tokenism. So we have one person here who's talking about mental health. That's one of the topics that I love. I love mental health, and I think it's one of the topics that we are covering here at the Rahai. Could you please introduce yourself?
What's up, good people?
So that's Zimbabwe.
Okay, thank you so much. I'm Leon Tinashe Matewa from Zimbabwe. I'm a youth helpline counselor. I'm a mental wellness coach. I also work for an organization called Youth Advocates. And at Youth Advocates, I'm one of the youth helpline counselors. So at Youth Advocates, it's a Pan-African organization that focuses on HIV programming, entrepreneurship, skills development. And apart from that, we also have a component called the 393 Youth Helpline, where we offer information, referrals, guidance, and counseling to young people. And apart from that, we we believe that there is life after counseling. So even beyond us giving you the counseling that you need, we also take time to also empower you so that at the end of the day, you are able to solve your own problems as well. So that's me.
Okay, that's really amazing. So when we talk about mental health, we have people like you who are actually advocating for mental health, who are helping in line of mental health. Please tell them yourself. Tell them. Okay, so she just came with a request. If you, our panelists, can be loud enough, because the people at the back there want to hear. Is that okay? Thank you so much for that. Yeah, so we have a lot of people who are advocating for mental health, but there are certain things that we see that keep happening. Okay, we have a lot of suicide issues that are taking place in our country. I believe you also have those in your country and in other countries that are here. So, what challenges do you really face in reaching out and engaging with these issues of mental health? Because if it was a success, as we can say, we wouldn't have been having some of the issues that we have. So that just proves to us that there are certain challenges that you face that don't allow you to reach that far. So what are some of those challenges?
Okay, thank you so much. So I think one of the challenges that we face in regards to mental health, it's at times it's underrated. No one really get to talk about mental health. And one of the things that we've normalized the abnormal. Like I think yesterday I mentioned this, that we've normalized pretending. Like you ask someone, how are you feeling? They'll tell you they are fine. And they will even smile at you that they are fine. But backstage, they are going through a lot. And if we talk about men, like in Zimbabwe, the leading data in terms of suicides are men who are committing suicide. So, and why are men committing suicide is because they've been indoctrinated that men doesn't cry. As a man, you need to man up. But at the end of the day, we are all humans, and we go through all the same challenges that anyone else go through. So one of the challenges that we face in mental health, we are facing a generation that is not willing to open up. If you've got a problem, they don't open up. You only maybe find out after they've committed suicide, or they've done, or maybe they are now involved in drugs. So despite those challenges, and another challenge that we also face is, I think in African countries, we don't have much rehabilitation centers for people that are going through some mental health
Yeah, that's
issues.
actually very true. That's actually very true.
Yeah, so sometimes you find out that in other countries, yes, they are like for in Zimbabwe, we've got, like I said, I come from an organization where we have got our 393 youth helpline. It's a toll-free number. It works 24/7. Yeah, but at the end of the day, as much as we are also trying to stand in the gap and supporting people in terms of mental health, one of the challenges, perhaps maybe it's a case of child sexual abuse, and you want the police to also be involved. Sometimes they'll tell you that we don't have the fuel, we don't have the car. You also try to link up with the Department of Social Development that deals with child safeguarding and child protection. They'll give you another excuse. So at the end of the day, that's one of the challenges that we face in terms of mental health. But otherwise, as far as mental health is concerned, I think there's need of a multi-sectoral approach where every government department is involved, corporates are involved as well, organizations are involved, and as individuals, we just we try the best that we can to have a culture of opening up. I love what women do. Like if they're going through something, be it marriage issues, they always talk to their friends.
He loves what women do. Men, we don't love what you do.
And they always, talk in their conversations. My person is doing this and that. And I also think that it's also high time as men, we normalize doing that. Open up at times, visit your pastor, talk to someone that you trust. Yeah.
All right. That was about my favorite topic, mental health. Copper Rose, why do I feel like we haven't heard anything about you yet? Have we? All right, so we can give it up to Copper Rose now. You can just briefly tell us what you do as Copper Rose.
Good afternoon, everybody. My name's Chibelu Shibibian, and I'm an advocacy and health promotions programs coordinator at Koparo Zambia. I have been at Koparo Zambia for 4 years. Yes. So Koparo Zambia is a youth-led and youth-focused organization that exists to create a world where young people are happy and just basically living to their full potential. And for us, really, we started out as a small initiative of students who were trying to raise funds to donate sanitary pads to their fellow students on campus, as well as the neighboring community from the university. So that's how it started, in case some of you didn't know the story behind Coparos. From that small group of young people trying to secure money, going door to door knocking to ask for 5 kwacha, it grew into an entire organization that has now presence in all the everywhere in the country apart from Western Province at the moment. So Coparos grew so much from the place of trying to champion menstrual hygiene and trying to end menstrual poverty, to now doing sexual reproductive health, to now doing gender equity, to doing HIV programming, and a bit of some mental health as well. So it's a youth-led organization. So it was started by youth and it's being led by youths. So just from there, you can tell that young people are meaningfully engaged, young people like myself, not just at a smaller level, but just the entire organization. You will find us dancing on TikTok because it's a bunch of young people. So that's really how it is. And apart from that, we also work very closely with Ministry of Health. Most of our programming runs in the health facilities. So we work closely with health facilities where we engage focal point persons, we engage healthcare staff to just also build their capacity and train them on how to properly offer services to young people. So we realize that it becomes an issue for young people to access services at health facilities. This is a conversation we've been having from even yesterday. So for us, what we're trying to do is to orient healthcare providers on what we are calling VCAT, which is just basically a value clarifications and attitudes transformation. So this has proven to be successful because we take healthcare providers through a series of training which is aimed at reforming their attitudes towards young people. So these trainings have been helpful, and we are recording young people saying, when I go into this and this facility, they welcome me. When I go into this and this facility, even when I want to access contraceptives, they are not judging me to say, what are you doing here, Yaya, and go back home. So really for us, that's the kind of change we're trying to create. And all of our programming, like I said, is tailored to help young people, be it in the space of sexual reproductive health, and also trying to build capacities, not only capacity to enter into the SRHR space, but also entrepreneurship opportunities. So we host sessions where we invite industry experts, gurus in the entrepreneurship space to just come and educate young people on how they made it in their journey as an entrepreneur. We also invite financial literacy experts like the likes of Liapambewe to just come and grace young people and just bring it at that level for the young people to also see themselves in the shoes of people like that who we look up to and say, oh, this is the well-established person. So really, it's initiatives like that that we're running. Apart from that, we also have a youth hub. Currently, it is running in the Copper Belt in Kitwe. The youth hub is open to young people to go there, study from there, do group discussions from there, use the Wi-Fi and also the library. We're also looking into having it also like a mental health safe space where young people can maybe go and talk to a mental health professional concerning their mental health. So really, it's such spaces that we're trying to create for young people to be able to find what to do in order to live fulfilling lives. Apart from that, we're also creating a platform for young people to participate in both local and international conversations and events such as the Rahai. So we have brought our own young people here as well. They are present.
Where are the Copperos young people? Okay, okay.
To of course attend the events like this to get more information and also to network, because we understand that there are certain opportunities that we can't offer them as an organization, but perhaps when we expose them into certain spaces, they'll be able to find those opportunities. We also, of course, offer mentorship sessions where we mentor young people to just discover themselves, figure out what they want to do, figure out what career path they want to take up, and also just ensure that the young people we are engaging are also undergoing through some form of a transition. So like my case, I'll equally give an example of myself. I came across Copper Rose and I joined as a volunteer. By that time, I was at the university. When I got to my final year, I did an internship with Copper Rose, and immediately I graduated. I became a full-time staff at Copper Rose. So that's the kind of transition they are looking, we are trying to do to ensure that young people are also gradually growing with the process. At some point, someone want to volunteer, but at some point they want it to be more than that. So we're trying to just establish an environment where young people can do that. So at the moment, majority of our staff at Copper Rose actually started out like that, and now they are managers, directors, and so on. So it's really that kind of a place. And if you want to know more, we equally have a booth. You can come through, have a chat with us, and you can learn one or two things from us. Thank you.
I really hate the fact that you've exhausted all the questions I had just from you telling me what you do as Copperos. So as you know, I love to keep the people engaged. So I'll strictly have 2 questions from the audience. Oh, I'm already seeing 2 hands. I don't want to see, I said I've already seen 2 hands. So the first 2 hands I saw were those at the back. I hope you guys don't have the same question. Yeah, at the far end.
So please come closer so that the live stream can be.
All right. My name is Mark Tembo. I'm coming from SAT. So my question goes to all the panelists. But before I ask my question, just one thing that I've noticed from different organizations and the organizations that are present is that you involve us young people and coming for meetings, yeah? But if you look at the people that get to attend those meetings, let's say you want somebody who is coming from Lusaka to represent young people that are coming from Chipata, that is not youth engagement really, and not meaningful. So if you want it to be meaningful youth engagement, you need to get a person who's coming from the community that you want to come and speak, so that because they are the ones that are going through those issues, they can express it. Now, my question to the panelists is, apart from SAT, I know what they're doing because I'm from SAT. So apart from SAT, my question is, how meaningful is your engagement in the young people that you get to send in different meetings? Then the other one is, because of SAT, I've been able to attend different meetings in different countries. I've gone to Netherlands, I've gone to South Africa because of SAT. But I want to know how your organizations, apart from SAT, how your organization help young people to grow in their capacity so that they can engage meaningfully.
Okay, thank you so much. Should we take another question or have a quick answer? Okay, so we can take another question. I hope we got hold of that one because I have a very, very short memory.
Let's have a female. Can we have a female?
A female, please. All right, there's one. Okay.
Thank you very much. My question would be, I think, directly directed to the presenter from Copper Rose, but yeah, you can take it. I wanted to ask, how sustainable and effective is the usage of reusable pads? I understand that's part of the work that you are doing. Considering that in this day and era, we are talking about things such as climate change. When you are giving somebody a reusable pad, you are expecting a grade 8 pupil to go to school with that same pad, and after 5 hours, they're going to remove it and put it in their school bag, stay with it the whole day, and then afterwards go back with it home. When they get home, they're expected to wash that pad with running water. But because of climate change, there's no running water. That child is going to have to travel again 10 k's to go and get water. But it's not running water. They're going to wash it in the bucket. So my question is, do you think as Africa, as the world, that's a solution to ending period poverty? Is it not actually creating more health problems? Is it not creating stigma amongst the young people? So I would ask, if can we come up with another solution to this? Thank you.
Okay, so we'll start with the first question. I would need one volunteer from the panel to give us one very brief answer because we're running out of time. So the person was asking how meaningful your engagements are to young people. Correct me if I'm wrong. Was that right? Yes, so we'll have, apart from Copper Rose and Sat, of course, because Copper Rose, you have your own question. Okay, just give us a very brief answer. You can, sorry? Yeah, Yak. You can give it to her.
Okay, I'm going to be very brief and quick about it. So how meaningful are we engaging young people? For us, the organization I come from, we allow young people to thrive in their own capacities and their own abilities. That means the only thing we do is to provide them with simple opportunities. For example, for you, Mike, that went to Netherlands and whatnot, it's because SAT wrote you a recommendation letter, and they also capacity built you in certain trainings, and you are able to write that application. They wrote you a recommendation letter, and you were selected. Okay, so that's the exact same model that we're trying to use. When you come out fresh out of college or university as a graduate, you've been trained. What we do is to provide you with a platform that you can call I represent this, because international and local opportunities want you to come from somewhere. They want to believe that you've been trained into something. When you do that, you now put your creativity on paper and write to say, okay, for example, if it's a Global Health Corps Fellowship, and they're asking you, why do you want to be part of the Global Health Corps Fellowship? You will say, I was trained in this and this by SAT, and I did this and this, and I'll bring this and this to the table. And when you write that, they'll tell you, okay, can you give us a recommendation letter of where you come from? And we'll write that recommendation letter. You would have been thriving and growing in your career as a person alone. Okay, and when you come up with your own initiative, you'll be able to do it. Why? Because they have trained you. So that's how we've meaningfully been engaging youths. Why? How we've just been giving you the hands and the niche in your head to know what exactly you're supposed to do. And that is what has helped to meaningfully engage youth. And when it comes to representation in meetings, you know, when they send you to go and represent them in these meetings, maybe their intention is for you to take pictures, but what are you doing yourself to represent yourself? Personally, when I go in a meeting, they ask who is writing notes. I would always volunteer. The first time I volunteered to write notes, I didn't know how to, but I went and asked, what should I write? They told me, write this and that. From that time, I go to very big meetings by UNAIDS. They always get me. Why? Because I write good minutes and I write very good reports. And I benefit from that, and I've got a very good name with them. Every time they have something, they call me. Why? I put myself out there and say, I'm capable of doing this. Corporals will send you to go and pose for pictures because they're a youth-led organization. But you yourself, are you just taking pictures? Are you just taking coffee and tea? Are you just seated there making noise, or you are engaging and asking somebody, where do you work from? What do you do? What can I learn from you? Do you have a training that I can learn from? Can I volunteer in that meeting, even if you don't pay me for this day, but I can write minutes and learn? The next one, you tell them, I wrote you a report last time. Can you pay me? You need to pay me. Now, for my time, I am now training to be a consultant. Whenever someone wants to consult me for a proposal, I always ask them to pay me money. Why? Because I'm capable. I can show that I wrote applications for 5 people, they got them, and now I'm very good at what? Why? Because the organization I came from trained me. You can do the same. Don't just post for pictures here. Go on your, do you have LinkedIn pages? Go and post about what you are doing. What were your key takeaways from their high? What would you want to see different? That is what meaningful youth engagement. It's a two-way angle. They do it as an organization, you also do it as a person, then you grow and you come back to them and tell them, I want to be your consultant. Thank you.
Okay. Before the chairperson kills us. All right, okay, because we are running out of time, let her just give us an answer on reusable pads. Please be as brief as possible. So we had a question from the audience, how when they were asking if you think that's actually a good idea, looking at the things that we are facing as Africans.
All right, thank you so much for that question. So when it comes to menstrual hygiene management, what we're doing as Copper Rose, we're trying to present all the options that are there for a young girl, a young woman to manage her menstruation. That's what we are trying to do. We're trying to present young people with choice. It's the same with contraceptives, right? We'll present you with a condom. We'll present you with the injectable medication. We'll also present you with the pills, the oral pills, so that you choose what works best for you as a young person based on your circumstances, right? So even with menstrual hygiene management, it's really the same. We have a lot of products, menstrual hygiene products, that we present so that each and every young person is aware that, oh, we have disposable pads, but we also have washable pads. We also have tampons. We also have menstrual cups. We also have period pants. So by doing that, we are ensuring that a young person knows everything that is at their disposal. And by doing that, it's really helpful towards ending menstrual poverty, especially the time when we started. We did not have the drought that we are currently having, and it was very helpful, right? Perhaps now, what we recommend, if you come to our table and you ask us, so since we're having a drought, what do you recommend? My answer would be a menstrual cup. So we have menstrual cups, and these are more like, they're more friendly when it comes to the issue you raised of water, distance, so on and so forth. They are more friendly in that way. Again, if you ask, okay, apart from this, what else is there? We'll present you with the disposable pad. We'll show you how it is used, how it is disposed, and we also lobby for funds. Currently, we're partnering with ShopRite to procure disposable pads that we are donating. So that's really what we do. Apart from that, we're also still, even though we're in a drought, there are people who still have access to water. Just because we're having a drought does not mean there's completely no drop of water in the country. That is not the state of the country. So we are still also championing those. We can't scrap them off completely, because one girl somewhere, that's what works best for them, as compared to someone else who say what works for me best is actually just a small tampon that I can just throw away once I'm done because I have no water. So that's what we're doing. And apart from just the products that you saw on our stand, what we're doing is also, the main goal for us with menstrual hygiene is to break the barriers and the cultural norms that exist when it comes to menstrual hygiene. There are girls out there who still think having their periods is dirty. Having their periods means there's something wrong with them. And that's the kind of notion that we're trying to fight, apart from the products themselves. Thank you.
Okay, I like the fact that there are so many options. So Sat would want to just give us something under 30 seconds, then we can close for today.
Okay, so just to mention, we have a program called YouthWise. It's an online platform that helps young people to get information on sexual reproductive health and rights. So I would highly encourage everyone in this room just to visit the YouthWise page and post something, then maybe you can also get a prize. Maybe tomorrow we can give you the prize that we have for the person that is going to post about what's happening in this space and what is some of the information that you've gotten in this space. So the page is YouthWise, and it's YouthWise Zambia, and you can get information there on sexual reproductive health and rights. Not only information, but we can also link you to the services that we have.
Okay.
you.
Thank you so much, guys. So that's all we had on this session of meaningful youth engagement. For those who still have questions, I can see there are a lot of hands. These are the faces. Don't worry, they'll be there to your aid and give you all the answers. Thank you so much, our panelists, for taking time to be here with us. Okay.
We can do better than that. A round of applause for this panel. Thank you so much for that panel. There's a request from the tech team that there's so much noise in the audience. And because of the noise that is being made in the audience, the colleagues on live stream are unable to hear what is happening. So we ask that you please be quiet so that the colleagues joining using YouTube, Facebook, LinkedIn, whatever platform can also be able to participate. I know UNICEF has something to share with us. So UNICEF, I'm going to invite you to come and speak in under 2 minutes. We are pressed for time. I will appreciate that you are very, very brief. After that, we are going to have a panel discussion on the new HIV infections. Harry and your team, please ensure that you are seated in front here because that panel discussion is coming next. After that, we are going to continue with our breakout sessions. So for today, we have 4 breakout sessions again. PEPFAR has a breakout session. Now for this session, are we together? For this session, PEPFAR only wants men and boys. If you identify as a man or a boy, you go to the PEPFAR session. The other session is with Waki Health. They'll be discussing the Choice Manifesto. The other session is with higher learning institutions. And the last session is understanding adolescents. So PEPFAR has specifically requested that we only have men and boys. UNICEF, are you ready? UNICEF, please come to the front.
So we just wanted to create a slot for the Regional Conference of Youth on Climate, since that request came on board. And so we thought they could just come and do that announcement quickly. Yes, Nat.
Hello, everybody. Wow, the energy is really giving. Hi. I don't know, maybe people are tired, but since I only have 2 minutes, I'll just get on straight to it. My name is Esnat Njovu. I am the co-chair for the team organizing the Regional Conference of Youth on Climate Change. This is, as you've heard, a regional conference for the youth here in Zambia that will be focusing on climate change issues that are affecting different youths across the region, which is Southern Africa. Now, for us as our core team and our partner UNICEF, we thought we'd come here to this platform and be able to have this conversation with you because we want to actually advocate. We've seen that climate change is a crisis, and it's not just a crisis that is affecting sectors that are commonly known, such as the agricultural sector and the like, but even health is a sector commonly affected by climate change as well. So we thought as we are having this youth health Indaba, we'd also come on board and just be able to share with everybody else here to say the Regional Conference of Youth, which is coming up next month in September from 25th to 27th here in Zambia again, we'll also have areas or aspects that talk to youths and health. So what we are advocating for is for people to just come on board and be part of this great conference that will not only look at what it means as a youth to be in this space and to face this climate crisis, but it also have to look at what you would like to do. What actionable intel are you going to bring on board? What do you want your leaders, your policymakers, different stakeholders that you have in your regions, in your countries to do for you with regards to fighting the climate crisis in different sectors such as health, agriculture, infrastructure, and everything else. So for more details, because I only have 2 minutes, For more details that you might have, you or can also visit at the UNICEF desk outside. They'll be able to give you any other details that you might need for the conference come next month, as well as also when it comes to registration, how you can be involved pre the conference. Right now, we have several capacity building workshops that are happening online as we speak, and also going ahead post the conference. So thank you very much for the time, and I hope you all visit the UNICEF desk as we go on with the conference. Thank you.
A round of applause for UNICEF. So we just left a panel discussion that was talking about meaningful youth engagement. Now, the danger right now is if you haven't heard what she was saying and you were making noise, because that is also part of meaningful youth engagement. She just announced that UNICEF is going to have a similar conference like this one, but focusing on climate change. If I were you right now, I'll be checking my phone and asking anyone from UNICEF that I can find in this place to send me a link so that I can apply. Let us begin to take advantages of opportunities like that one. Are we together? So she said, visit the UNICEF desk outside and get more information. So we'll be moving into a panel discussion, into an interface panel discussion. But before that, again, I'm emphasizing breakout session leads. Make sure that your rooms are clear. The first room is with PEPFAR, men and boys only. The second room, which will all remain here if we want to be part of the Choice Manifesto with Waki Health. The other room is with higher learning institutions. The last one is understanding adolescents. So I will ask Harry and his team to now lead us into the next session. Thank you.
Good afternoon. Good afternoon. Let's do something here. Can you give me one word that you have learned since the day started? Just one word from this side. Adolescent. This side, one word. One word. One word. They have said adolescent. They have stolen it from you. Meaningful. Thank you. This side, one word. Engagement. This side. Sanitary. Oh, okay. Please look for another one. Another word. Another word, please. Leadership. Okay. So what we are going to do is that when I say your word, you stand up. When I say the other people's words, you have to sit down, right? So what you are doing is just standing up and sitting down when I say your word, right? All right. So we had adolescent, meaningful, engagement, and leadership. So we are at the RAI 4th edition, and a lot of adolescents are attending the event. They are discussing leadership, they are discussing meaningful engagement, they are also discussing issues surrounding the adolescent. But the leaders in themselves, the leadership are not standing. Thank you so much. Comrades, my name is Harry Simuntala, and I'm going to be your host for the next session, where we are going to look into solutions. Time 6:07, we are going to be done in the next 20 minutes with this session. Allow me to welcome my panelists. I'll start with Honorable Twambo Mtinta. Please, the stage. We'll move on to Oranda from Zimbabwe. We'll move on to Piri from Malawi. Let's give them a hand, let's give them a hand, let's give them a hand. We move on to Mr. Patnasia Utua. We move to Comrade Anin Sambu. I hope I haven't forgotten none of my speakers. You clap for them, don't worry. Okay, so like we said, I think the last speaker, can we be in one session, please? Can we be in one session? So, like we said, we are going to have a session about solutions away from those presentations. So we are flipping things. So we also have a Minister of Finance from Zambia, and his name is Buson Sonda. Please, can you have the stage? So, what is going to happen there? I know you have met Honorable Twambo, who is a member of parliament, but there is sitting as a young person from Itejiteji. I know you have met Mr. Partnership Tumwa, who happens to be also in the board of in the board of youth platform, but is sitting there as a young person who has been benefiting from NGO programming. Then we have Comrade Hani Sambu. She's actually our Minister of Finance for today. Minister of Health, rather. Then we also have another Minister of Finance from Zimbabwe. We also have another Minister of Finance from Malawi. So I'll be asking them questions. My timekeeper, the person who stood, if I say 1 minute, they must be done. They are not done, they have to sit down. Are we clear? Can I have the mic this side? Come on, clap for me now. Clap for me, clap for me. You know the beauty with what you have done is that if I make a mistake, this thing doesn't go well, you would have clapped for me already. So I would have won. Thank you. Okay, so dear panelists, like we said, you're presenting the young people. You are the government, because as young people, we have been blaming the government. We want to find out what solutions can you give as the government. Minister of Finance, how are you going to do your budget allocation? Because you have been discussing, asking leaders that they're not doing something right. Some applies to you, Minister of Finance for Malawi. We want to find out how is your budget going to look like? And what are some of the solutions and innovation that are you going to adopt in order to respond to issues of HIV for the adolescent and the young people? Minister of Finance will ask you similar question. So to start with, who do you want me to start with? Okay, let's start with the Minister of Finance from Zambia. Honorable Minister, there have been calls that since the Abuja declaration of making sure that health has got 15% budgetary allocation, what do you think has been your failure as a Minister of Finance?
Good afternoon.
1 minute.
As government, through the able leadership of His Excellency, President Mr. Hakainde Hichilema, as government, we have not failed, comrades. As government, we've been making efforts. Since we committed to the Abuja declaration of 15%, we've made strides and we've continued to press on.
Your trying is not enough. What is it that you are doing wrong?
Government, comrade, when we first signed the declaration as Zambia, remember that budget allocation to the health sector was at 9%. From 9%, we moved to 10%. As I speak to you right now, the budget allocation for health has moved to 12%.
What's the budget for this year?
This is what I'm saying, comrade. We are at 12% this year. As we move to next year, our commitment as government.
Thank you so much. Let's have a young person from Iteji. You have heard what the Honorable is saying, but do you think these numbers, the budget, do they reach a poor young person when it comes to the prevention of HIV and AIDS in a rural setup like Iteji? 1 minute.
Thank you so much. To be honest, as a young person from a rural most area, Mr. Minister, sir, we are not seeing the benefits that the government is rolling down to the poorest. Minister, I want to be practical. You might be saying the budget has been overall increasing from 11 until 12. We appreciate that. But how many youth-friendly spaces have you constructed in the rural areas?
Our young
Minister, apart from that, in your budget, do we have a specific budget line that deals with adolescents? Thank you.
Again, our young person, we want to find out something from you. What is the most critical ask? What is the most critical and the most fundamental question that you can ask your leaders?
Minister, for me, I want you to give an assurance that budget consultations have started. How many youth-led organizations have given an input in the budget consultations? And are you giving us an assurance that
Thank you so much. Thank you so much. Thank you so much. All right. All right. So we are on that point. So we are trying to establish, we have tried to establish the context of Zambia. Let's try. If Zimbabwe can give us something new. Zimbabwe, we are told that you are doing so well with prevention.
Comrade.
First of all, Minister, we'll give you the chance.
No, as government, we wanted before.
We'll give you a chance, Minister. Thank you so much. We'll give you a chance to respond, Honorable Minister. Honorable Minister, you are doing so well when it comes to prevention. But yet again, we are told young people do not have access to SRHR, which facilitate or precipitate the accumulation of numbers when it comes to HIV and AIDS. What is it that you are doing differently? And what is it that you can acknowledge you have failed to do as the government of Zimbabwe?
Thank you.
1 minute.
Okay. Thank you so much for the question, young person. So you see that
1 minute, Honorable Minister, 1 minute.
Okay. So you see, as the country we have okay.
Let's pay attention, Honorable Minister is responding.
As a country, we have a lot of pressing issues that we have to tackle as a country. So you young people, you are getting mischievous. You are having sex at an early age, which us young women did not do that. So
Honorable Minister, you
we are
can
having
proceed.
sex at a young age. We have the older ones. We are not having sex by that age.
Honorable
Our
Minister,
parents
so
would
you
beat
are
us.
confirming with us that you have failed.
Yes.
You are confirming that you have failed.
As a country, but you keep pushing us.
Thank you so much, Honorable Minister. Now let's get the views of a young person who has been benefiting from these NGO-led support. He has represented our country at a lot of conventions. But the question is, as a young person, what change have you created from these conventions that you have been attending? And what is that one solution that you think is going to help us respond to the new infections when it comes to HIV new infections?
I think we have a challenge.
1 minute.
In terms of our national programming, we have not been able to put young people at the center of designing this program. So yes, we have attended a lot of international conventions and we actually signed to a lot of these conventions. But when we get back home, our implementation success score sheet shows 0. And even when you look at what we are doing nationally, for example, today we are talking about having to have youth-friendly spaces in health facilities. But some young people have to travel a minimum of 10 kilometers to get to a health facility. So why not create, for example, youth-friendly spaces in the community where they live? And I think...
I'm told that you are attending the International AIDS Conference. What did you learn and what are you doing as a young person in your community?
So what we need to do now is to take stock of the previous commitments that we have made as a country. So then our leaders and the other delegates that go there should now go there and take a different story. Because I think that these stories have already been described as tokenistic. We need to go back there and show real evidence of what it is exactly we are doing and the change that we are making. So if we can't account for the things that we have done, it's even very difficult for us to justify, for example, as a country, why we should continue benefiting from the global national resources about support to our national budget. So we need to demonstrate.
Thank you so much. In your last word, I want you to prepare a question to these ministers. We have the SADC chair, we have the Minister of Finance from Zambia, we have the Minister of Health from Zambia, we also have the Minister of Finance from Malawi. So we prepare one important question. What is the key ask of the young people of Zambia or Southern Africa?
Great, we will.
Let's go to Minister of Finance from Malawi. We are not doing so well. What is wrong? Why are we failing as a government?
All right, thank you very much.
1 minute.
All right, with budget allocation, of course, we're still struggling in terms of the finances. At the same time, we are able to work with Minister of Health and to provide the information that the young people need. But there's a collusion between the policies that the government is making and culture.
Honorable Minister,
Yes.
can you confirm that in your government, especially your budgets, I read your budget, you make budgets and expecting to be funded. When are we going to have health sovereignty as a country, as Malawi? What is it that you are going to do?
What a question. All right. On the issues of sovereignty, health sovereignty, we tend to mobilize local available resources. We have to promote the patriotism spirit. We have to own the budget. So we'll start with what we have with regards to issues of health.
Are you borrowing? Are you borrowing?
We are going to borrow domestically.
Thank you so much. Honorable Minister, I think you are hosting us here in Zambia, and we are happy. Are we happy that we have been hosted in Zambia, right? So we want to find out from you. Last year, you gave a very convincing speech of what the government is going to do. You told us that young people are at the center of our work, young people that, young people that. Why are you trying to impress us? What is it that you are doing now that is different from last year? And what solutions, new solutions that you are putting in place, aside from the policies? I know you are going to refer us to policies, but what new solutions are you doing now?
Okay, thank you so much, young person. I think as the Ministry of Health, we've done so much in the HIV prevention compared to where we were 10 years ago. I think one of the things that we've done, especially to young people, we have brought youth-friendly spaces in communities. We've asked young people to actually apply to the local authorities.
I'm told there's no funding for youth-friendly spaces.
The funding is there. It's just that
all the TVs are stolen.
Okay, in 1 minute. The funding for youth-friendly spaces is there. It's actually in the strategy, and the local authorities have been instructed in communities to actually carry out this project.
How many youth-friendly spaces have benefited from CDF?
Oh my Lord.
Okay, thank you so much. Honorable Minister, 1 minute.
So, comrade, we shouldn't mislead young people. And this is why, as a responsible government, we've made sure that every school in Zambia has civic education so that young people are able to understand how policy works. As a new Dawn government, we've made sure that through CDF, we've targeted specific components to ensure that young people are empowered. Health is one of it. We've moved resources away from central government, closer to the people, so that the people themselves can make decisions and invest in things that are very important.
Thank you so much.
Thank you so much,
Honorable Minister. Thank you so much. Thank you so much. So in our closing, I've received few questions from you, our lovely participants. Honorable Ministers, in your portfolio, I'll excuse our very honorable young people here. I want you, ministers, to respond to two questions. The first question is, why are you failing as the government? The second question is, why are you not prioritizing the health of young people in your budget? That will be your closing. Young people, kindly give us the solution. What's the way forward from now? What solutions are we going to implement from the constituencies of the young people?
Well, thank you so much. As a young person myself, I will not blame. Partly, I will not entirely blame the ministers. I also want to blame myself by asking myself this question: how many of us as young people have applied for CDF so that they construct a youth-friendly space? So I want to challenge myself as a young person that we should also do away from talkism and begin to act. So I'll only blame my member of parliament if I'll apply and he does not accept my application. So from today onwards, I've repented. I'll never blame these ministers and I'll never blame the minister. I'll blame myself, and I'll be more assertive. Come this year, I want to apply for a youth-friendly space myself as a young person in ITSS. And I know the member of parliament for ITSS will ensure that the CDF committee approves that youth-friendly space. Thank you.
Thank you so much. I think we can conclude with the young people, and then we'll go to the ministers.
Going forward, I think that we need to claim our spaces as young people in these decision-making places. Let us go to the ward development committees where resources for prioritizing local development are being met. And when the bigger people are sitting to discuss youth issues, those resolutions should not be taken as our reflection. There is nothing for us unless we are in those spaces. So we should not allow big people go to conferences and they constitute 100% delegation of older people, and there's no young person sitting in those spaces. So, but I think that we need to be available for this kind of assignment. It will never come easy. So we need to identify ourselves as co-creators of our own health and of our own development. So these old people will never come to us and say, come, come, come. We have to demand for our space, and then we can participate. Otherwise, they'll continue enjoying and continue to misleading themselves that young people are participating, and yet we are just used as rubber stamps.
I love the fact that important words are coming out. I've heard of the word assertive. I've heard of the word demand. I've heard of the word being solution-oriented. Those are important words that we need to discuss. Honorable Minister, why are you failing? And give us your closing in 1 minute.
Okay, I think as a ministry, we are failing because we do not have localized funds that are specifically made for health. We have not mobilized. We have a lot of policies, a lot of strategies that have been put in place, but we are not implementing because we have failed in terms of localized funding. We cannot fund ourselves as a ministry. And we've also failed because we have not done so much on PrEP and PEP in terms of sensitization in the community. Most of the young people and most of the people do not know about these drugs. We are also failing because we have failed to be very inclusive in the universal health coverage, which is 2030. We do not have, even up to now, we still do not have people in health facilities that are able to attend to people with disabilities. So we have failed as a government.
Thank you so much for admitting. It's not easy. Honorable Minister, please. Why are you failing? What's the way forward?
Okay, as an honorable minister, it's not like we are failing, but you know, it's written in the constitution that with the resources available, we can deliver. If there are no resources, no, we cannot deliver. We have so many pressing issues in our country. So we cannot only focus with the health. We have other issues that we have to do as a country. That's according to do. So it's not like we are not pressing, we are not forgetting you as the young people. And you know, we have our local clinics in our local communities. We cannot build some other clinics while we have others. Let's use our local clinics. You young person, you are being shy on attending health services at our local clinics, and you want us to build another ones. We will have the resources. You want us to get the resources.
Thank you, Honorable Minister. Thank you. I'm told time is up. Time is up. Honorable Minister, why are we failing? What's the way forward?
Thank you very much. We are still failing on resource mobilization with regards to budget allocation to the health sector. On the same time, our approach is more of a top-down kind of approach, and we tend to misunderstand the needs of the young people. So the way forward is to engage, to tend to employ the bottom-up approach to understand the needs of the people so that we can include them in the budget. And also on the resource allocation, we'll make sure that, okay, we are failing on that resource allocation to the young people. Way forward, we're going to provide a plea to the young people to attend budget sessions, pre-budget sessions, so that their needs will have to be incorporated into the budget. Thank you.
Thank you so much. Honorable Minister, in your closing.
Comrade, for me, we can't say we are failing as government. And hence, we go back to the issue of CDF, number one. The encouragement thereof is that young people themselves should take ownership of CDF, go back to your communities, constituencies, and wards, and encourage your ward development committees to ensure that those resources are allocated to issues that are important to you, number one. But also, you will realize that in the 2023 budget, my ministry allocated over 20 billion to the health sector. And this year, comrade, I encourage you to look out for the budget and you will see that the allocation to the health sector will increase. But also CDF this year, the president has directed that also should go up to ensure that resources are taken to the people. Beyond that, there are
Thank
other
you
things
so
we're
much,
facing,
Honorable
challenges.
Minister. Thank you so much. Let me just get, what lessons are we drawing from this session before I allow my panelists to go and sit? Somebody from Ministry of Health to give us in less than a minute, if we can manage.
Good afternoon, everyone. Thank you so much for the good discussion, and Mr. Moderator. From this discussion, at least we have been able to pick that we need more adolescent health spaces, and we will need to get help from our partners, since there's an aspect of having less resources. So we need a lot of partner engagement for us to have these spaces that adolescents need. In fact, spaces are not only needed in health facilities, they can also be in the communities. So since there's an aspect of community engagement there, let's also engage the communities, and we are part of the community that are going to create these spaces ourselves. In line with the CDF that has already been indicated, let us initiate as adolescents so that we get what we need as adolescents. And thank you very much.
Thank you so much. Thank you so much to our beloved panelists. Now I come back to you, our audience. I'm not taking questions. My chair there is trying to kill me, that I've already gone on time. So I'll not take Chair, can we indulge us with just 2 minutes so that we can get 2 questions from our audience, please? I didn't get the KPIs.
Thank you very much. I'm Moses Soko. I'm seeing the panelists. Most of the youths here question about benefit for CDF. But your answer was like, you are blaming the youths. You like to blame the government, right? About applying for CDF. I've already benefited from CDF, but I am not defending or subtracting, no. So, for example, why does the government fail to bring councils here in meetings like this or workshops to teach the young people where they should start from? Because when you apply for CDF, you must have cooperatives. You must have clubs or cooperatives. Maybe the youth here don't know about that. You must bring people who are responsible for registering under CDF so that they know where to start from. You bring them here for workshops so that they teach the youths how to get, they should get ideas on how to start from. Don't only say blaming the government, or they are right, the youths are right. Because you failed to bring the people who are responsible for teaching them. And again, at Wide IC, many CDF offices we don't have. You only stand outside, or sometimes you only stand in the councillor's office, the council offices, maybe from morning to afternoon. But how can people know about the CDF? So please, my humble request is you should upgrade or up your game.
Thank you. Thank you so much. I think that's very powerful submission. So I'm going to be very biased because I can only choose one person. And I know you are itching with your submission, but I love equality. So
Thank you so much. Finally. Thank you for pointing at me.
Be brief. The chair is about to take away our powers.
Okay, so my question goes to the government and also the Ministry of Health, to be specific. So in relation to what has been talked about today, beginning in the morning, there was a report that was presented concerning the different districts in Zambia, the different provinces, of which Southern, Eastern, and Western appeared to be top in terms of HIV and teenage pregnancies, while Lusaka appeared to be the lowest. And then when we look at the geographical location and the social status, you find that Lusaka is more developed compared to this, which brings me to start thinking, how often are these other parts that are underdeveloped reached out to? And when we talk about community engagement, how is meaningful community engagement done by Ministry of Health and maybe other CSOs that are present? Because we want you to put us at the center and not pull us as beneficiaries. Then lastly, government, what does resource mobilization look like for you so that we can attain the actual adolescent sexual reproductive health sovereignty? Thank you.
Thank you so much for those amazing questions. My sincere apology, I can only accept those hands. But in closing, my grandfather always used to tell me that words are sweet, words are bitter, words are weak, and words are powerful. What matters is the action that are going to follow from those words. Ladies and gentlemen, my name is Harry Simuntala. Let's continue enjoying the show. Let's give a hand of applause to our panelists. Thank you so much.
Well, thank you so much, fellow youths. I'm tempted to make a very small statement. Are we together? So myself as a young parliamentarian and somebody who is passionate about this agenda, I want to mention to you that there will never be a government like this government that has taken resources closer to you. What is just required is for you to be assertive, to be engaged, and to ensure that you claim those resources. So I want to give you one good example. Every year, in Itezitez, where I come from, I've got close to 16 million money that sits under CDF. Now, last year, I appealed to the young people in Itezitez. They said, can you apply for a youth, for a construction of a safe space, or a youth-friendly space where it's just a building? You don't need a lot of windows. It's not complicated, which can even cost less than 100,000 kwacha. The young people, they failed to write that application. Are we together? Now, the intention to write such an application is not made by a member of parliament. It should be driven by yourselves. Whether it's a church group, whether it is a movement, whether it's a club, as long as it is registered, you just pick a form, you make an application that you want to construct a youth-friendly space. I've always challenged my fellow young people that I want you to challenge me that as a member of parliament, you refuse to fund us, but we had made an application for this, and none of the young people was able to give me an answer. Let me give another example. Using CDF, do you know that you can buy menstrual pads costing over 1 million? If you make that decision, it's very possible. Using CDF, do you know that people have been buying footballs, people have been buying jerseys? What can stop you from buying condoms and distribute them to all the centers or distribute them to all the schools? So I want to appeal to you that can you identify members of parliament who are your allies, like myself? If you want, let any one of you help the young people with testers to apply for a youth-friendly space. Come next year, we'll construct that youth-friendly space. Is it clear on that one? So when we meet next, I want someone to challenge. And I want you to identify members of parliament who are your allies. identify them, work with them, help the communities where they have no capacity to write a simple proposal. Then when we meet next year, can we now start challenging those members of parliament to say, we had applied for this, we had applied for this, we had applied for this, and it was not picked. I can't blame a young person. We are still learning. But let me say the civil society organization, let them come out of Lusaka. Can we go in the villages, like someone was saying? That is where the needs are, and that is where the money are. In Lusaka, no one will give you that money to build a youth-friendly space. But in the villages, that is very possible, and the monies are there. Let's take advantage of those resources which are right there in the rural areas. Thank you so much.
Thank you so much, Honorable. So, Honorable, as a commitment, he has given us a commitment which is very good, right? So, is anyone volunteering to help young people write? Okay. So we have 1, 2, 3. Not takers, please take their names. Honorable member, will get your contact so that we can do that. So that next year, we are going to report that out of the discussion, we did something.
A huge round of applause again, and for that commitment as well. That is political action. We said turning political will into. So just like we did yesterday, it's been a fun relationship since morning, and it's that time of the day when we take a break. You know, breaks are very healthy. So we are going to split up again. So listen carefully. In this room, the main dome, we are going to remain in the Choice Manifesto breakout room. So if you're interested in the Choice Manifesto breakout room, remain here. The one about PEPFAR, men and boys. This one, only men and boys are going. Natasha, where are the men and boys going? Yeah, not all men and boys. Not all men and boys. So men and boys who want to join the PEPFAR session, you can please go outside. And then also for the higher learning institutions. Higher learning institutions is in Mushili, so make your way to Mushili. And then PEPFAR is where? Next to Mushili. So boys and men only in the PEPFAR session, but not all of them. If you're interested, go to that one. Higher learning institutions as well, go to that one. Your facilitators are already waiting. Let us move. So no, that one has been removed. So we only have 3 to pick from. So please, let's move. Let's get moving. PEPFAR, only boys and men. Only boys and men. Higher learning institutions, follow Natasha. Natasha, please raise your hand. Follow Natasha. Choice Manifesto, remain here. Higher learning institutions, follow Natasha. The lady in red, boys and men, you're going to PEPFAR. Please hurry up. So for those remaining in this breakout room, please move to the front. If you're staying in here, move to the front. If you're staying in this room, move to the front. Move to the front. If you're staying here, for the others, please let us go and join the other breakout sessions. Harry and Annie, move to the other breakout sessions. Let's move.
Orji originali gangi di tutia bra. Katia mie nao ni mawingo. Libi imbeje. Libi semeje. Libi aije. Libi papeje.